Now we move on to another interesting and hallmark of our workshop, and I think Geeta is the star of our workshop. Her workshop is the most sorted one. I got a lot of calls saying that we want to attend only Geeta Madam's workshop. I said, no, you have to come for 4 days. Otherwise, you will not be able to listen to Geeta Madam. So I think I'm looking forward to Geeta, and over to you.
Thank you so much. That puts a lot of pressure on me. Maybe I connect with food, and food is happiness. Food is comfort, food is satisfaction, food is social, food is celebration. So many things come with food, and that's why I become the favorite, I feel always. Because there's not much resilience with the food. It comes only with a diet food. So more that term of dietitian, I think we are better off as nutritionist or nutrition expert, because that connects us with others. So thank you very much. Thank you, Vaishali Madam, for your presentation. I think I've learned a lot in these sessions with you, because formally there was no psychology for us as a nutrition student. We never had any interaction in any forum with a psychology or psychiatrist. Through these 4 years, I think I've learned a lot. And of course, that all what I've learned started also thinking me differently in my practice. So today, what we'll talk in all this session is, we know everything in food. Huh? I mean, I've been talking about in 3 days, people who have missed it had few hacks of that. First day we had some experience, second day yesterday I gave some kind of dictatorship on various thoughts on how to eat. So these all I wanted you to capture the experience, and today we'll talk about all that. I'm not going to tell you, do not eat, do not do, eat mindfully, chew 24 times, 32 times. I think we are not here to learn that. Let's learn, let's understand evidence, let's see how can we change. Like we talk about neuroplasticity, it applies so much. Like we talk about adaptation to that particular habit. So let's see how I can do it, and I will definitely invite Dr. Phadke sir, Vani madam, Vaishali madam to compliment me, because they know the science better in that area where I would like them to intervene. So what will you go back after this 2.5, 3 hours of this session is definitely a good gut. Because we all know gut and enteric system has a lot of role to play. Metabolism, we need to understand what a metabolism is. We need to understand mindfulness, and a lot of confusion on the word of nutrition. Because as a dietitian, people keep asking, is vegan good, is keto good, is this good, and is that good? In a personalized era of nutrition, there's so much to offer. And that's what I think we'll take back from here. And let's see how I look at it. We'll talk about cases, we'll talk about your experience, we'll have more of interactions here. And I want you also to give inputs, because we are going to talk about tools. I have 2 questionnaires. I think all of you have got a small 2-paper.
No, we didn't get.
I've kept it in each table. I think there are a few here, if you not. Keeps you alert, and it keeps you thinking and vision about wonderful food and nutrition here. Not telling him do not eat, be disciplined and all that. There are a lot of other challenges with this patient. So we generally take a recall and we see where actually the problem lies in the recall. And the identification is, he's a snacker, terrible food focus. Almost most of you have come across such kind of people. Dietitian friends definitely will say. Snacking and volume eating. This was the major challenge, because obesity is all about energy balance, and we know expenditure and intake mismanagement actually gives you something called as either obesity or malnutrition in an undernutrition stage. So let's keep this case in mind, and let's unwind few things, right? So what we are doing today is connecting mind and body. Food is a very integral part of it. So somewhere I was thinking, evolutionary process of us. As we evolved, food evolved, cooking methods evolved, culinary science became very, very predominant industry. And now that hotel management is now divided into culinary science, hospitality. So food has got great, I think, industry, and it's a $1 billion industry now for us to look at it. It's not always about nutrition. It is a lot to do with other aspects with food. And that is why I think it's important that we are exposed. 3 days we've been here, right? The exposure of food has been enormous. I'm sure all of you agree with me. The breakfast, the lunch, evening snacks, and the dinner. The buffet is late, and then you have a choice to make: how much, what, and how. So definitely, when you start eating, I'm sure from today evening you think differently. So when you start looking at the food and hunger, who we are as eater and what do we eat, we definitely think about it. And somewhere we start looking at evolutionary process, and today I want you to introspect, only think about yourself while you're doing this journey, so it's easy to apply on others, rather than looking at case studies and your relatives and somebody who needs nutrition help. Just be yourself today, because you'll find a lot of answers in yourself for gut health, metabolism, and all what we're going to talk about. And hence, there's no tool for this. I don't know if the doctors here find, is there any tool for mind and food relation? I couldn't find any. So I made a small questionnaire. It's given in your 2-paper thing you can take back home. And I want Dr. Fatke sir and Vaishali madam to validate this tool for us. It's a simple 5, it's not validated, I've just made it this time. So next year maybe we present you with more validation, more inputs in this questionnaire is welcome. Because I thought there should be some kind of an assessment channel where the physician, the doctor, the dietitian feels only dietitian is not enough. He needs a therapist. Some kind of a tool to understand. Otherwise you go to dietitian, you take medications. So we need some kind of an assessment tool to screen them, especially when it comes to weight management or NCD, because the major challenge is food. Exercise, how much can you burn? Exercise, in fact, is not a weight loss. Exercise is, I'm sure you can tell us, that 250-300 calories maximum we burn. The 300 calories, I think a cup of coffee and a small dhokla, 150 calories are in. So, it's not all about looking at exercise. Exercise is a different goal prospectively. I think it all revolves around nutrition. And if you want to keep that nutrition in mind and send it to an expert, because at least in India, what I have observed in practice, if a doctor tells the patient, you have no choice, listen to her. It is more easy. Our job becomes more easier. Because it's very much medical oriented aspect here, and people believe doctors more than any other therapist still now. So if you, in NCD or any practice, try to tell us, go to a dietitian, listen to her. Come back to me only after the weight loss. And if she tells you to come back to me, you come back. That makes more easier if your dietary instructions doesn't follow. So a small tool, and Dr. Sir, to me, Nauta, I want you to help us to validate this tool in this 2 years, because it's simple questionnaire of BMI, recent weight loss, because you have subjective global assessment tool, which is mostly for hospitalized patients, where there is a data taken for weight gain, weight loss, behavior change in the food, like this case we can talk about that, why is he snacking, why is he volume eating, doesn't he have appetite satiety control, sleep changes, exercise discipline, hydration and energy issues. I think these few questions we can always validate, we can always score it and see whether he just needs a dietitian, he needs a dietitian and a psychotherapist, does he need a psychiatrist. So somewhere I think some tool for us to channelize when to send the patient to a dietitian from doctor's point of view, I think should help. So this is how I thought I'll start, and more questions from you, welcome. Before that, we'll have a discussion, there's lots to talk in this 2-3 hours what we'll do together. Before that, 2 days, who were present here yesterday and day before yesterday, I have 2 columns, experiences. Page number 2, refer to worksheet 1 and worksheet 2. Day 1, people who missed it, what I did is, we had warm water here, and I gave a bowl of pickles salad, and said you have that, and go down and eat your meal. So quick, I'll keep talking, you can keep rating it, whoever have experienced it. The question is very simple, it was saying that how are you feeling now, and before meal and after meal. If you remember, very good, if you do not remember, that's fine, because as I said today, you're going to only think about yourself. Think about yourself and see where you fall, things become more easier. So how do you feel? How generally I eat my lunch? Because it's a different scenario. You're with people, you're talking, you're socializing. Quantity eaten for lunch, was it same what I eat every day? Was it more? Did it make a difference to my meal? And how many times did you feel you overate today? So these are few questions in both the sections where you can try to analyze, write it. Day 1, did the warm water salad help you to eat less, feel early satiety, change or it didn't make any impact for you. It can be either way. Each one of us is different. Day 2, a typical Indian traditional lunch, where I wanted it to be in a pattern where we all, when we go to, I mean, every culture has it, that we call it Pangat in Maharashtra, where we sit, there's left side, there's right side, there's rice dal eaten first, I should say dal rice, and then we have main course. So I don't know how your experience was with that meal. Generally we don't eat that way. In house we have only 4-5 items. We have roti bhaji or dal chawal. Maximum we have salad. There's a variety here. So what was your satiety till when you didn't feel hungry? Because there was immediately bhaji at 5:30. Did you immediately eat that because it was raining outside? So all this thought process, maybe you've not thought. Think about it and fill the questionnaire at your own way. Take your own time, because today you're going to only think about yourself. So let's start. Food is nutrition, because all of us here learned, and we meet a dietitian, we meet a doctor, we meet any health expert, we talk about only nutrition aspect, deficiencies, nutrients and all. But more than that, I think food is information too. There's a lot of information and connect of food and my mind and my health. And in that information, if I add a lot of these anti-nutrients, it's been proof studied that if there are a lot of bad fats, bad sugar, refined flour, preservatives, a lot of dairy and a lot of non-veg, if these predominantly enter your meal, your thought process, your mind, all that changes post-meal, which you may not feel it in the usual. So it's sattvic, tamasic, I think we can have experts here to talk about it, because I'm going to talk about that same. So these are labeled as anti-nutrients for your mind, because moderation is absolutely fine. I have the cheesecake is being served almost every day. So I have a small bite of cheesecake because I like it, I enjoy it. But I take 5-6 cheesecakes, maybe that's a bad fat which is getting too much accumulated in me. So these are anti-nutrients which may interfere. And now you have coffee on your table. And you've seen, you felt, there was no need, you just had your lunch. But the sense organs still stop you. Many people are used to having coffee. Like sir has a shot of coffee regularly, post-meal, espresso shot. So caffeine. So coffee is talking to you. There's also a few questions on coffee, you can always mark it. We're doing some warm-up with food, understanding here. Can you spot where the questions are? Feedback 3, yeah.
So Friday we had hot water and salad. So what did you feel on Friday is what you're supposed to write in feedback 1. On page 2, there is feedback 1. That is Friday meal. We had hot water and salad before the lunch.
Correct.
So that is the time when you are supposed to be marking. You try and recollect. Recall what you felt. Did you feel hungry? Did you feel that it was time to eat? You were forced to eat? And what did you feel after that meal? So that is what you need to mark. And then Saturday, as Geeta said, that we had a Maharashtrian meal. So how what did you eat that day before the meal and after the meal?
Friday, yesterday.
Maharashtrian had warm water and salad.
No, I think
You can
this
take
was.
it this way. You can take it this
Yeah.
way. The day 1, we had hot water and salad. The day 2, we had Maharashtrian lunch. So no, don't need to worry about Friday and Saturday. This was actually planned on Friday and Saturday. The hotel could not organize that.
And then the feedback 3, you can always say, how do you look at coffee now? You're hunger or you're happy to see it and smell the coffee?
How many of you ate the dhokla? Oh wow, Geeta, you have a lot of food for thought. And how many of you had the coffee?
One sip.
That was a huge score now.
So this question 2 is very interesting. I want you to ask yourself, what is this coffee talking to me? I'm a hot beverage, right? I'll make you alert, drink me. You had a heavy lunch, you better drink. I'm making you alert. Is this what the coffee is talking to you? Coffee says you enjoy my feel and taste, please have it. Or the coffee says I give you the feeling of my journey from beans to coffee. So you're looking coffee as more of nostalgia, you're looking coffee as more of connect. It can be anything, it can be one more than 2. right? Okay, so you spoke with your coffee, you spoke with your dhokla, there was no need, but then you tasted at least. The smell, the senses alerted you. This was also a nutrition hack because we wanted you to analyze yourself. How unmindful we are. We are talking here from 3 days of mindfulness, and somewhere maybe that's comfort. Again, we will not talk as unmindfulness here. We may talk as comfort, we may talk as happiness, we can talk as connect. So, end of the day, is food nutrition or is food something else?
Madam, it could be habit also. Just the thing is there in front of you. And
It's a habit. Celebrations. Okay, how now? Just one or two. We won't waste a lot of time. But 2 or 3 people. How do you look at food? Energy source. So that's nutrition here. I doubt we don't look food as nutrition most of the time, but I appreciate it. Happiness, comfort.
it is kind of energy.
Somebody?
As a nutrition.
Yeah, happiness.
So last thing is nutrition, am I right? Only when the dietitian or doctor is in front of you. When I've had so many people telling me I'm not going to eat in front of you or whatever. And whereas I also want to eat whatever is there, so please allow me to eat.
Stress buster.
Stress buster.
Happiness and
Stress, satisfaction, nutrition. Nutrition is last. Anybody thought of nutrition apart from energy? Coffee doesn't give us energy, it gives a thick. Caffeine. So you now have to ask yourself, like ma'am said, is this habit for me? So somewhere you can say that, ma'am, I think you can take that. So how do I behave with the food? Even if it is a habit, am I a child? I don't ask questions. It is in front of me and I eat. Am I a child? Am I a victim? I give up everything. I accept the situation. 4 दिन diet गया खड्डे में. I will eat whatever is given. I'm going to enjoy myself. Am I a victim? Teenager, I love to break rules. I want to play tantrums with my food. Talking to yourself, huh? There's nothing like that, right? Are you being wolf? Disciplined throughout? I lost 3-4 kgs by the time I came here. 4 days I'm not going to think anything. So I'm being disciplined, and my body gives up to all this visual impact of food, which I'm actually enjoying since 2 days, and I give up. Or am I a saboteur? I'm suddenly turning from good to bad. When I just 4 days not thinking of calories, I eat till I feel overeaten, not satisfied also, overeaten. And the last is, I have no relation with food. I think food is just calories, proteins. Many people are mechanical with food. Any of you, you're mechanical with food. So what do you mean by mechanical with food?
It means, so I very hardly, very seldomly I have cravings if I look at the food and I
You didn't have your coffee?
No, I had because I didn't have lunch properly. I had very less lunch. I never overeat or I don't crave. Even if the pizza is in front of me, I won't be the first person go and.
But you eat or you won't eat?
I would, unless I am hungry, I will.
So you will look at it and you won't really react to it.
I'm absolutely fine.
So you never had any problem with your health? You're very comfortable, or you still feel I need to work on food?
No, I'm very happy with the home cooked simple food. Once I'm done with that time of eating, I'm very happy. I don't get cravings or.
So you're conditioned, or you give the credit to the genetics?
I have no clue.
So I think.
So I have never worked on that.
You worked on it.
Never worked on that.
So end of the day, what we're trying to understand is your relation till now. What we're actually coming to a conclusion is your relation with food. This is 0.001% mechanical with food. But yes, there are people who are mechanical food. But then if there's no connect with food, that also I think is not a very good thing. Let's see how we can. So you can ask yourself, how do I look food? Many a times guilt. He said, forget guilt and eat what you eat. Either you don't eat or don't feel guilty. But you eat and then you feel guilty. So again, guilt.
Even people who don't eat, they also feel guilty.
Correct.
That they are wasting food, so they eat more.
That's a major problem with us. Urlela Anna we say, for a mother, it is leftover child's food. For a housewife, it's more about feeling guilty about leftover. So whatever. Look at food as problem. Many times you have people that I don't store anything in my house because I keep eating it. I don't get biscuits, I don't get anything. I said, you should have all that and see that how you can Stay away or eat mindfully or consciously, rather than not stocking it at home. How many of you come into that category? Not putting anything at home. I mean,
I don't buy any junk food.
so if you don't buy, you don't eat. You don't eat. Even your, did you have your
No,
3
that's why
days?
I'm wolf now. He's like, when I got chance, I
She's
go,
into
okay,
wolf
I-
category, okay. So that's more dangerous. If you really get, and that's a conscious decision of hers that she's not consciously looking at getting the junk food. I would say keep stocking all the favorite foods at home and see how you can mindfully learn to work on it rather than, even I would say the dietitians that allow the patients to do what they want to do and teach them mindfully. This strict no in food doesn't work. And that's what I think we are here to understand, and how to overcome all that and what are the tools we can work on it. Of course, comfort and happiness, most of us come into that factor. Don't feel guilty about the coffee and dhokla. It was just to tell you that, see, this is the relation of you and the food. The food gave you the information and you had it, start feeling good about it. And evil and a problem. Somebody invites you, you want to go to that house, enjoy the oxytocin and all that what we've spoken about. But you said, every day I have some invitation, every day I have to go out and eat, every day somebody comes, so I have no choice, I am exposed to variety and I eat. So you feel that's a problem. So I think accepting the food in a very beautiful manner, creating a good relation with the food is what we want to work on, each one of us here. Once we are able to do that in this session, maybe we have a better way of looking. So a last line which says, if we create more internal freedom around how we see food, we can really work on metabolism. So people who felt guilt here, irritated, angered with oneself, I shouldn't have eaten it, why am I exposed? I think create a positive equation, step one, and promise you it won't hurt your weight, it won't hurt anywhere. It will help you to have better metabolism. Because you're thinking and you're eating consciously with a lot of awareness. Do that experiment, it works that way, right? And then see how it works. Because there are obstacles in, when you say nutrition, you can't be an alchemist, you can't be an absolute old scientist here, right? But most of us here end up doing this. Most of the time, I think most of the doctors here, once you finish your OPD, you want to go home. Just want to eat. You don't know what you're eating. But you want to fill yourself, right? You want to fill yourself. Or you want quantity of food. You know I've had an evening snack, still you want to eat your two chapatis. The 2 chapatis are very important for you. It's not important how hungry you are, do you want to eat or not, but the 2 chapatis makes you feel contented. So again, these are obstacles. Quantity of food, food fulfilling, and most of the time we forget what we eaten. How many of us remember yesterday? Of course, this menu is different. But at home, females spend a lot of time planning menu for next day, right? Males don't even have to think about it. But then she may remember because she planned it, she bought the vegetables, or person who does it at home. But if I ask you what did you eat yesterday, which sabji, how many of you generally remember that? And if you, very good. And we have good audience also here, 0.1% here. And suppose you didn't eat something which you enjoyed, you're on a diet or you're really made up your mind, you missed out that happy meal. Gulab jamun, whatever. Will you remember it? I did not eat that gulab jamun, still I did not lose my weight. So these are common scenarios that we forget what we eat, but we remember what we've not eaten there. And last is fear. I think we all have to start looking food as information. Start working our equation with it. You can't generalize. Now each of you have defined your food relation now. With coffee, with other 2 days. So the homework is already set in that now I have to start looking food and build a relation with food. And this relation of food is, definitely is going to be there in my memory. Atithi Devo Bhava in our culture always associates our happiness and hospitality with food. Vaishali Madam was very concerned that 3 days we have to give them a good meal, so they take back good memories from here. So food becomes a very integral part. And then traditional meal, many of you liked it also. You enjoyed Shrikhand yesterday, you enjoyed Usar, Misal Pav was there. All this adds to your memories and happiness. So we now, all of you agree with this? Food is a information. So how many of you still will feel guilty with the food? Or you anyway don't feel guilty?
I feel guilty. I didn't notice many of these nice things which you are describing, the cheesecake and the secret.
You didn't notice? Molly, the invisible. Interesting. So, food is information. Your CEO is your mind, and your COO, the operating officer, is your gut. So there's a lot of communication between CEO and COO, and the boss is your brain. Your brain defines, because except for air and water, everything has calories. Negative, positive, whatever. Calories, a unit of energy, involves heat. We know the equation in physics. Aerobic respiration, it involves oxygen. So the biochemistry starts right away when you start eating any kind of thing. But we want to tell myself, why does he eat so much and doesn't gain weight? I hardly eat, still I put on so much of weight. So, it is not just calories. Of course, it has the calories, but it is nutrition, connect, and energy for me. And I would like to invite Dr. Deshmukh here to explain this brain-gut connection, because I think nobody could do justice better than her. The science behind this gut-brain axis, and then we'll take it ahead from the food as to. Over to you.
Yeah, so I think Geeta has made a different perspective of how we look at food. But there are two things to it, that how we look at food is also not genetically determined. It's determined very much after feeding starts. So this gut-brain axis, so-called, we know that gut is called the mini brain. Why it's called the mini brain? Because the enteric nervous system has a surface area which is much more than the brain. So if you count the number of nerve endings in the enteric nervous system or in the gut, it will be much more than what is there in the brain. And there are nearly 30 hormones which are produced by the gut, which are not produced in the brain. And surprisingly, 95% of serotonin in the body comes from the gut, not from the brain. So when we are saying that depression is caused by serotonin deficiency and any other effects of serotonin and GABA, the so-called GABA and so-called serotonin, the major source is the enteric nervous system. So we are talking of a second brain. That is why you see in traditional, even our ancestors, they pay a lot of attention to motions and emotions related, both.
Yes.
So the day the emotions are not good, the emotions are bad. So this has been a history and this is a fact. So basically what is linked is that the emotions, the behavior has a link intricately with the gut hormones. So what are the gut hormones? Why are they produced the way they are? Why do I feel crave for sugar and she feels crave for salt? Why she craves for spicy things? It's all determined by the number of or the volume of or the type of hormone produced by the gut, and which is acting on your satiety center and craving center and center, the NPY and the PYY, which we are talking in the brain. So where this whole thing. So by liking for food, you say that this child likes sweet right from birth. How does he like sweet from birth? Because the first food, the moment the breastfeeding is started, the gut has no immunity of its own. The gut has no hormonal secretion of its own. It starts with the first food that goes into the enteric system. So, say the breast milk of the mother is the first food which goes. What does the milk have? It has proteins. The proteins are what? Antigens. What do antigens do? They act on the immunity. So, they will act on the gut immunity to produce something called as gut immune tolerance. So gut immune tolerance starts on day one of birth, and this gut immune tolerance decides the lifetime choices of that baby. So how many of the kids and how many of us really take into account what the child is fed in the first year of life? Now this is going to decide the gut immunity of that child. This is going to decide how leaky the gut is. There are three things which the gut immunity decides. The gut immunity decides which hormones will be stimulated in the gut. Secondly, it decides on how leaky the membrane is going to be. How many antigens it will allow to cross. How much of that food will be converted into bad food, that is short chain fatty acids, which is toxic to the intestine and the gut lining. So all this will be decided by the first food that goes. And as this food becomes more toxic in nature, you see fast foods going into kids, you see different type of processed foods going into kids. This short chain fatty acid is going to change what? The first time the child is fed, you have a mucosal immunity, and with the mucosal immunity, you get bacteria. You get, normally the gut of a fetus is sterile. The moment the child is born, the first bacterial flora is through the vaginal passage of the mother. So that's the first bacterial flora. So that is the initial gut flora of the baby. As these food transforms this bacterial flora, you get a gut microbiome which is changing. When gut microbiome changes, what happens is my food goes into the gut, the bacteria acts upon it, it produces some end result organ chemicals which act on the nerve endings of the gut. So this is how this whole enteric nervous system is developed, stimulated, and then starts the process of how it acts on the brain. So once these chemicals are active on the enteric nervous system, the enteric nervous system will stimulate two things. It will produce enteroendocrine hormone secretion. So it will make GLP-1, it will make insulin, it will make say CCK and many other gut hormones. And it will send signals to my brain that yes, I am hungry, my insulin is high, I am feeling hypoglycemic, I will crave for sugar. So my CCK is high, I will get increased peristalsis, I can get cramping, I will feel hungry frequently. So all these signals transform into behaviors. So the enteroendocrine hormones are the ones which stimulate. And second important organ which we spoke yesterday was the vagus. Vagus is the main afferent of the enteric nervous system. So when the food is going to stimulate the enteric nervous system, it's going to stimulate the vagus. So you know the effect of vagus stimulation. So there are certain foods which will inhibit the vagus. There are certain food which we call as tamasic and sattvic food. So why do you say that buttermilk is relatively good for the nervous system of the gut? Because it is known to improve the vagal stimulation. So it is known to make a person calm and quiet. Tak rose gaya jevnan, limbu rose gaya. Why these probiotics are enhanced? Why do you want to have curd rice after every meal? That is because that these are foods which work as probiotic. They soothe your enteric nerves and they also enhance the vagal stimulation. So you get more parasympathetic activity, and we heard a lot about autonomic. I don't need to tell you on that. But how food is directly linked with the autonomic nervous system is through these pathways. So why it is important? It has been found, in fact, that the gut microbiome of lean people versus obese people is totally different. In fact, more the polyflora, the better is the metabolism. So in fact, they found that obese people tend to have less of gut variability, the microbiome variability. As compared to the lean people are known to have more different types of flora which is more helpful for producing certain neurochemicals which enhance vagus. So why alkaline brash, why fiber, why lot of fruits, why lot of veggies are suggested in sattvic ahar is because all these are known to increase the microbial flora. So what is probiotics? It's a highly concentrated good bacteria into that particular liquid or capsule, and that is what is known to improve the gut microbiome. Why gut microbiome is important? Because it is going to improve the gut immunity, it's going to improve the neuroendocrine system in the gut, and also enhance the emotion and behavior related to food. And as Geeta rightly mentioned, that you eat spicy food, you eat mutton, you eat fried food, you eat non-veg, you tend to be more irritable, more sympathetic activity, more sweaty, and more drowsy, more short-tempered with certain food. Similarly, with certain kinds of food which are known to be inhibitory to the vagus or stimulatory to the vagus, you tend to feel more calm and quiet, and you feel very good in your gut. The gut feeling comes from that word. So what you feel in the gut is the primary feeling, and please take it as true, because gut feeling is a true feeling which occurs, and it is through the enteric nervous system that a person can sense the emotion. So when I say my gut feeling says that I should not go, please listen to that feeling, because your gut is a very sensitive nervous system organ and it should not be neglected, and especially the food which is, and we see a lot of patients with food allergies and intolerance. So suppose you have XYZ patient telling you that XYZ food हे खाल्ल्यावर मला असं होतं, प्लीज डोंट इन्सिस्ट, नाही हे काही नाही होते, हाय प्रोटीन आहे घ्या. Because definitely that food is telling the gut that no, I'm not feeling good. So irritable bowel syndrome is because of that, acidity is because of that. Lot of our insulin and acidity is directly linked. So hyperacidity, depression, insulin resistance, pre-diabetes, diabetes, all these are interlinked in the sequence. So food changes, food choices are going to affect all these systems, and I think brain-gut axis is a topic for itself. It can be a workshop in itself, and how you modify the food. And in fact, hormones are not only produced in the body, hormones are there in the food. You see banana will have serotonin. You'll have dopaminergic foods which will pacify you. You see kesar is taken at night because it's going to calm down. So all these kind of effects are seen with food because food have hormones. Finally, hormones are chemicals. So we are talking about what hormones we eat and what hormones are produced in the gut and what hormones are acting on the brain and what hormones are produced in the brain. So you can see that there are 4 different neuroendocrine systems acting in the body beginning from food. That is why there is a statement saying that we are what we eat. So we become like that. It is said that I don't know whether it's true or false, people who eat chicken become chicken-hearted. Then people who eat non-veg tend to be more irritable. This is what is spoken. I really don't know, but there are certain, at least in Ayurveda, there are the tamasic and sattvic food types described, in which they say that to help your behavior, it is better to have sattvic food and have certain niyam in terms of eating and following in terms of behavior control. So I think that explains this whole system.
So exercise 1, have you written down your relation with the food, each one of you, so you don't feel guilty about it from next time, you think positively, it helps metabolism. And 2, yes, my gut says a lot of things, so I need to have a gut feeling with my food, and definitely we'll talk about it. There is a gut-brain inventory, and we know that yoga, we've been talking about it, integrated medicine from Nimhans also has done a lot of research, and I was actually asking sir, so have you intervened with food? Because it plays a lot, as ma'am was saying, there's a lot of bioactive components which will influence your gut and it can help the neurodegenerative changes which are happening. So gut-brain inventory almost has these areas, but it's not important. Each one of us follow everything. Today, that's why we're personalizing what you want to talk to yourself. You've written your equation with food. You've noted down what is my gut feeling. If somebody asks you to eat proteins and then you want to eat a lot of proteins and doctor said eat proteins and you're not an vegetarian, you're a vegetarian, how would you react to that egg? You eat it as a medicine? Do you feel good about it? I mean, your inputs on that? Yes or no?
Lots of patients will eat it as food. There are a lot of vegetarian patients who have been asked to eat protein and they will eat egg white.
Exactly.
And they will eat it as a medicine.
Correct.
They don't like it, but they eat.
So what happens, sir? They are ready to leave the ones the doctor says, or they get better or detached from the medications or whatever. It's not a sustainable activity which they feel because it is forced by by loved ones because doctor ne bola hai khana hi hai. But then the gut feeling told the person that you can't eat proteins. And I personally am not a very great fan of proteins. We will talk about it. But there is an adequacy, there is a bioavailability, there is a digestion limitation of proteins also. And they are definitely allergens, they are triggers, they are inflammatory. So the definition of protein needs to be standardized and we should know what a protein needs to be in my diet. It's not that vegetarians have less protein, we need to understand, we'll talk about that as we go ahead. On your exercise sheet that, okay, I'll try this. One thing, maybe warm water, somebody who felt better, maybe slow eating. So all that yoga, let's wait and watch because we will definitely get a feedback of yours. Now I have to give you tools. I can't keep talking about all the psychological aspects because we have experts here. But I have to look at tools which will help you to identify and work on it. We have to have like yoga, HRV, a tool where we are supposed to alter, adapt. So is there any tool in nutrition or food where I can help my body to adapt? So the first tool, I think we have now gut microbiome and nutrigenomics coming in a big way. I'm not a microbiologist, but these reports now are getting into more of wellness industry or in an industry where there's an autoimmune or IBS where it does help us to identify your bacteroids, your gut flora. This test is done in many of the companies. They assess your stool, they repeat it after 6 months, and genomics is done once in lifetime. So you do have tools to check your metabolomics is coming in a big way. So we are looking at using food bioactive components as tools. So a lot of formulations with inulins, a lot of formulation with FOS, mushrooms I was talking about. So food are looked at bioactive components because when you say curcumin, the tablet curcumin, haldi and curcumin. So you pick up a bioactive component from that food and you, in this world of omics, most of you know what an omics is, a genomics, then you have metabolites, and the study of this metabolites is metabolomics. And this metabolomics is now coming in a big way to identify these bioactive components. It starts from soil nutrition to plate nutrition. So I think when we analyze any study, especially in nutrition, we don't look at it holistically. You don't know the soil health, you don't know the food health, you don't know the internal health. So there is a lot of role of AI here to work on integrated systems biology. So if we are doing a research, we have to start looking at soil health to plate health and metabolomics and so on and so forth. So somewhere, yes, there's a lot of research now going on gut microbiota and its role in treating mindful eating, food behaviors, eating behaviors, food patterns. So definitely you have a lot of understanding of gut health with some kind of a tool now, which you can start interpreting in your patients, because we know the inflammation from gut, we know your oxidative stress, you know your bacterial flora, and you do have foods to help you. And this is a different topic by itself. What I'm trying to help you understand is you have a tool of gut microbiome, where if any of you here also feel that I need to assess my gut because IBS can be unmindful eating, cravings, and number of areas where you know that you are weak in and you want to work on, then you can definitely work on it, because this is the pattern of report you get. And definitely in that pattern, one of the column talks about eating behavior, stress reduction, cravings, anxiety and depression. These can be assessed by your gut flora, and food can be used as that. It's definitely one of an alternate method, but I would like to, after this, ask your inputs, your thoughts on it, how you look at it once I finish it. So this is how your gut microbiome report looks. What's important is a good bacterial ratio, Firmicutes and bacteroids ratio. So this ratio of your stool tells you where you stand in your gut flora. And we all know that you cannot replicate your gut flora. It's again genetics, it's very personalized gut flora we all have. You have to create your own gut flora, so taking a lot of probiotics will lead to SIBO then. Histamine generation, SIBO, so that's not an answer again. So if you know your areas of gut where you lack Firmicutes and bacterial ratio, and you know that what is your gut performance score, then somewhere you need to understand that how will I now, with this kind of a performance of my gut, not all people need to go, but definitely it's a wellness test, we can always assess ourselves and work out. The test cost is quite expensive, it's 10,000 to 12,000 rupees, and it is done every 6 months, because it's not an answer. Let me finish this, the report, and then we'll talk. Definitely there is a neuropsychiatric and behavioral insights here. You also can understand your dopamine metabolism, serotonin metabolism. You have your GAD and MDD susceptibility, because it talks about a lot of gut microbiome which actually contributes to it. So they have just sent me this snapshot of a report of a person who wanted to understand his mental health with the help of gut microbiome. And this is how the report looks. The gut microbiota expert tries to identify the bacteria and then relates the bacteria to the mental health. And they definitely try to make your relation with food by specifying the food which your body needs, because they've identified the prebiotic which contributes to the gut flora which your body needs. So definitely this is how the report looks. It comes to the dietitian. Dietitian can talk to the patient and incorporate that in the manner where patient's gut feeling tells that which foods he can definitely have. So I think these are the diet recommendations which come in this gut flora the report. They themselves send 300 grams of smoothie, so increase your vegetable fiber, cook fat, use CGM, avoid exposure to xenoestrogens, fiber content. So all this definitely talks about what is needed to change your gut flora through food, through prebiotics of your food, and then repeat this because genomics cannot be repeated. So you really don't know in genomics how much confirmation you have, except for gluten and lactose if you do. We'll talk about that also. But this report definitely makes an impact. Like they do have behavioral, mental health, eating behavior. This is how the report looks. That eat your meals before time, before the hunger pang sets in. Because the gut flora tries to tell a lot of challenges with the enteric system or the gut flora system which we have. And then it tries to gives us this report. And I don't know how much it has, there's no research saying that it's beneficial because again it is human adaptation, behavior management, the costing, n number of areas added to it. But scientifically we know that gut flora has been researched to work on my mental health. Questions? So,
The last part looks a little too experimental to me. I mean, saying that, do we really have enough data on?
again, this is very risky because the diet is variable. Region-wise, it's not specific. That's what is my question to them. Region-wise, it's not specific. They are gathering data. As the stool samples come, they are gathering data. This company is based in Mumbai. So they have done a lot of sample of Maharashtra and they said that through the Maharashtra samples, through the Maharashtrian diet. But again, in a cosmopolitan country like us, food is very variable. So we have to pick up the good things and ignore the bad things if we really look at it. This is how I can see it.
Madam, I didn't understand about the DNA genomics of
I'll come to genomics. I'll come to it.
gut flora.
Every bacteria, the flora bacteria. No, there's no genomic here. I was trying to, the first slide.
The first slide, it checks those bacteria, no? That one more before.
It's a genomic of a human being?
No,
Yes.
no. So this tool, no?
Huh.
So this
No,
tool.
that's a tool, but then your gut flora is very individualized and personalized. You cannot mimic probiotics as per your gut flora. Your body makes its own gut flora through the prebiotics. You don't have a standardized because every genetic makeup of a gut flora is different. So that's why we come from personalized to precision nutrition.
She's asking what is the sample for this?
No. She's asking there is no genetics in the
Of course, it's a flora, ma'am. It's a bacteria, so there is definitely a genetics.
It's a bacterial genetics or it is our
Our, we are host, so our genetics. Yes, you want to say something?
What I read, like, the ratio of human genome and bacterial genome is 1:364.
Correct.
Like human genome is only 1 and 364 is
That bacteria.
The sample is the
Stool sample. Stool sample. It's a stool sample.
And while prescribing the remedies also they have advocated this avocado and
Yeah, definitely. It's a Western report. We still have. So I'm trying to give you a tool which is there in the market, which you should know that okay, there's something like gut flora. There's no still a lot of research to be done. We're in a very primitive stage of understanding. So this tool is taken with criticism. We do not look at it as a sole way of looking at it, but this is one of the tools where you can, especially with chronic IBDs and all, you can think about it. You have to say something.
genes decide what
Go ahead.
flora we are going to have.
Not done that. How the microbiome changes the gastrointestinal lining.
we study
So that is what
genes don't decide.
So what genes are they checking?
It is the flora which the epigenetics decide. Genes don't decide, but
What are they testing in this? In the
stool sample, the gut flora, the microbiome. Microbiome is
They're
tested.
testing the DNA of the microbiome.
DNA of the microbiome is tested.
So
And
not
that's
the-
very-
not the host.
Host
cells
is
are
a
not
different
tested.
genomic report.
Yeah. That's your saliva sample.
Yeah, that's a different thing which we'll talk. You had to say something,
What
sorry.
is genomes? This flora, for that you have to check that sample of stool.
Stool, yeah, the stool sample is checked for gut flora.
Go to that bacterial flora
Transplant is
chart.
also done.
Fecal transplant.
Fecal
Fecal
transplant
count
is
is
also
checked.
Those are all very experimental.
One more slide.
These are very experimental
One
based.
more.
But it is done, it is now
It's
tried.
not practiced. This one. So yeah.
They will
Yeah.
access also.
Yeah, so madam, this is what it checked. So the prevalence of this gut microbiota based on the genome.
Yeah, but our genes don't decide our gut.
But this is very personalized. Your flora is as per your. That's what they check. It's a different genome sequence completely. The floral sequence is completely different. You have to say something, please.
Ma'am, there is just one question and one. I think what about inside what I have read. One thing is that the antibiotics part in the microbiomes has not been discussed. That is a very big thing we as a medical fraternity should discuss. That after every that antibiotics, there should be a course or something natural or medicine. Second thing is that, ma'am, as I have read that there are near about more than
3 trillion.
3 trillion microbes, biomes are there. There are different types also, and our health depend on those all the things. So I disagree with one thing that it can't be reconstructed or it can't be.
No, we didn't say it can't be reconstructed. It
If
is.
there is destruction is there,
So you can replenish it.
just replenish it.
So that's why the food list, the probiotic list is
So
all.
first thing, the question is the main question was that medical fraternity is not aware about this
That's
thing,
right.
antibiotics and everything, how much damage they are doing to our gut
In
flora.
fact, this report can help assessment of dysbiosis. So
Correct,
what
the
is
leaky
degree
gut,
of
the
deviation
dysbiosis.
from normal sleep is what this report can help. It is just a tool, it is not an authorized
My
tool.
question is not this. My question is very, very simple. Thing is that I have not seen, I am a doctor. I have not seen my colleagues to recommend probiotic or prebiotics with antibiotics. Very rarely, along with that.
Most of the antibiotics are
But-
augmented
but-
as
I
lactobacillus.
think medical doctors here can comment on it more than me.
Augmented has lactobacillus in
It
it.
has, but not
Most antibiotics have. I mean,
Not yet.
some of them
we
don't.
recommend it strongly.
the quantity which is needed to replenish that, it's not there. And doctors are just depending on the medicine that it has. So doctors as such are not aware that what things are doing. I am not against the things because being a medico, I am also experienced the things. It's just about the awareness.
I agree with Dr. Sandeep because obesity is one of the manifestations of gut dysbiosis which has occurred in childhood antibiotic overuse. So we have seen this as one of the theories for obesity induction, that the gut flora of a kid is totally changed with overuse of antibiotics and in fact that was one of the reasons why antibiotic usage has been restricted, that it is known to change the gut microbiome to the extent that it can cause disease processes. Like one of the blamed risk factor for NCD occurrence and rise is also gut dysbiosis. And gut dysbiosis, there are many causes, including stress and GI disturbances and other things. But even autonomic disturbances is one of the causes. But antibiotic overuse has been one of the predominant cause. And antibiotic use in the first year of life is a direct risk factor for occurrence of this. So usually they don't advocate use of antibiotics in the infants because of this particular. Yes.
But like more than the antibiotics, the first food itself, now the predominant use of formula,
Formula food is also.
I feel that has a lot of impact.
Yes, definitely. It's at least been proven in diabetes. So type 1 diabetes occurrence has been more common in non-breastfed and those who are being fed with cows or buffalo's milk. So it has been related very well to type 1 diabetes occurrence and autoimmune disorder in the form of type 1 diabetes.
So the restoration
Is
is happening.
bacterial flora constant throughout the life?
Yeah, ideally,
It's tiny.
if you are able to maintain a constant flora, you will be the most healthiest person.
It
But
doesn't
what
happen.
happens is that there are a lot of events in life, like wrong eating, when you are eating processed food, when you are
Environmental
eating
factors.
late nights, when you are having stressful conditions, when autonomic imbalances, it is going to alter the gut motility and gut microbiome. So one of the aspects of treatment of dysbiosis is also the fecal transplantation. So there are a lot of techniques now coming. In fact, Ayurveda already has that. Basti is one of the modes of mechanism of changing the gut dysbiosis. So I think that people in Ayurveda will know more about this, but they focus on colonic health because they change the gut microbiome. That is what I get. Yes.
So
Actually, I would like to add one point here for microbiome. You know, there is a misconception that we think that taking prebiotic or probiotic is going to give you healthiest microbiome. Because more the variety, you will be healthier. And what happens is like there are certain type of bacteria will be increased with that prebiotic or probiotic. You are not going to go back to having healthy. And thing is like what is healthy is different for everyone, and it changes every day. And what Ayurveda is trying to do is like every day when you know the first bowel movement you have in the morning, it's considered as your daily newspaper. Malada considered as a daily newspaper means how your microbiome has been, how your digestion, metabolism has been. So you get reports daily. So you can assess yourself. And that is possible only with like you will consider food as a different aspect. And she had really wonderful points that food is not calorie. It's nourishment, it's energy, it's information, and it's farm to table. And every processing, every interaction, everyone comes with that food, it changes that. Means, that's why Ayurveda gives more emphasis on like how that food is being processed, how it's stored, even the vessels which you are cooking food in. So, and you remember the gradient, concentration gradient. What happens is like whatever is lower, it will flow to that side. So if you are eating food that is already lower on energy, information, or nutrient side, it is going to take it away from you. So that is the basic thing. It's not about calorie, protein, fat. Once you will get that idea, things becomes very easy.
So that is mentioned in TAB.
We can talk about food list definitely.
Yeah. But to answer one point which Vaijanji was saying, that your hormones also decide the degree of flora that you will be getting. So it has been found that hyperinsulinemic people tend to have one particular type of microbiome which is having one selective type of bacterial overgrowth as compared to the other one. So that is why it has been found that obese and diabetics and insulin resistant population has less number of microbes as compared to those who are healthy. The more the number of microbes in your gut microbiome, the better is your health. So, like autonomic immunity. So, variability is a need for gut microbiome also.
Yes. And as compared to Western flora,
take back home from this message is gut flora is definitely researched and proved to impact all areas of health. Chronic inflammation to NCDs to mental health. So let's take report in a positive manner where you understand dysbiosis, leaky gut or the Firmicutes bacterioidetia rather than looking at the tools which they have mentioned because that data is not there. What prebiotic to eat is not there. Then the dietitian's skill to work, because once I know there's a dysbiosis, definitely I have my tool Ayurveda, modern medicine, we can integrate all that and start working on the food list. That one we take. Second, we take Dr. Sandeep's point as more awareness for replenishing because one antibiotic dose, one analgesic dose washes out your gut flora and then it takes time to replenish it and there needs to be a diversity in a gut flora and food takes its own time because of environmental impact. So awareness needs to be created in the fraternity to work slow or look at the areas where you don't really disrupt the gut flora because again you end from low grade inflammation to chronic inflammation. That's something is take back home message here and definitely an integrated way of looking at this. So this was a tool which I thought we should know that yes, I can know my gut flora and I can work on it and do the testing again to see where I stand. So food can play an important role or environmental food, exercise, hydration, everything. Next, another tool which is there in the market is nutrigenomics. Now this is more into a wellness cosmetic area. But yes, there are few genes and we know the biochemistry behind them, the MTHFR, the dopamine, because they are precursors for the backbone, for your all this endocrine or endocrine transmitters. So definitely the dopamine receptor or the COMT, MTHFR, melanocorticotropin receptor. So all there are reports now, the reports are tailor-made. There are a lot of genetic companies in the market. Pathology, genetics run hand in hand. This is a one-time report. Again, this is a 5 to 10% of your tool. You can't depend. First, I think the environmental impact, but you know your tendency. Of course, you have your inflammatory genes. So genetically with this human genome study of 2002, you have around now 50 or 300 genes which can be modified by environmental impact. So this study of human genome has given us some bouquet of some genes which can be epigenetically modified, create a nutrition, exercise, sleep pattern. It's again a holistic way of looking at how epigenetics can be applied here. Nutrients also play a very important role here. Any questions on genetic testing? Then we can take it ahead. Then I now talk about nutrients here.
I can share a story. You can share your experience because you helped me.
Go ahead. Gluten? She's gone into sports and we all know Djokovic and all, they have been openly talking that don't eat gluten. And most of the sports people are very open in talking that even BCCI has done the genetic testing for all the players. So the sports genomics coming where you know your endurance genes, it's a rich body, so they now have done for all female players also. So you know your endurance genes, your injury risk, your food pattern, all that can be checked through your genetic report and is being done more into cosmetic factor. So as she treats a lot of sports people, one of the examples we want to highlight. Besides sports, this is a blood test. It can be your hair, it's a DNA testing, hair swab, your sputum,
So any
cell on the body can be taken for that.
What I wanted to share was, besides sports people, of course, insulin resistance and PCOS is also seen in our clinic. But personally, I had a lot of low energy issues. Exercise, gymming, Zumba, Pilates, everything was going on. But still, I was feeling extremely fatigued, feeling sleepy, not being able to complete a book or else read a research article. This happened back in 2010. And then in one of the conference was, of course, I did meet few gastroenterologists, I met an Ayurvedic practitioner, but somehow none of it helped. Then later, I had been to a conference where they were presenting case studies on celiac disease. So there were a lot of symptoms listed out. Then right from next day, just avoided a lot of wheat products which were there in the diet. So I'm basically a Keralite, but living in Chennai. While I was in my mother's house, I was eating a lot of idli, dosa, red rice, the Kerala variety rice and all of that. But later when I got married, my husband and I like wheat bread sandwiches, rotis. So the diet had changed since I was cooking at home. So that's when I think all this issue started. Then later when Geeta told me about nutrigenomics, I got myself tested, sent the saliva sample to the lab that she was working in. I had non-celiac, that is intolerance. So gluten and lactose. So both. I was aware of gluten, but I was not sure that I had this. But that was a game changer, and that truly helped in improving my health in a big way. And this was also helpful for some of the clients. There were a lot of kids who had constipation, and they were extremely thin. And because when a child is thin, what happens is the mother will give aloo parathas, 2-3 glasses of milk, milkshakes. This is what is given. So we've had a lot of children who've been coming to the clinic with constipation, psoriasis, a lot of dermatological issues and all. So the moment we got the test done and removed gluten and lactose from the diet, there was some remarkable improvement. In fact, we have a dentist player. Yeah, we have a dentist player whose parents are radiologists. So in fact, they were quite shocked at how just changing the diet made a big difference after the
Timely, and I also have quite a few of patients who have intolerance, food intolerance, and apart from the nutrigenomics, the simplest test is the food intolerance test. That we do it commonly with our thyroid patients, especially. I have one patient who stays in Ahmednagar. This lady was diagnosed as irritable bowel disease initially. She was walked up, she was found to have some ulcers and she was treated for irritable bowel disease. Then she was eventually fine for a period of time. She's currently 60 years and she was fine in this period of 20 to 25 years of age. And thereafter she started symptoms like irritable bowel syndrome, and she always had this complaint. She had been to all gastroenterologists in town. She was referred to me for thyroid. She was treated with thyroid. I thought she's having Addison's because she continued to have loose motions, watery diarrhea and everything. And then finally we could not find any answer to all this. But she responded to steroids. The cortisol was normal, she always responded to steroids. So you give her 5 days of steroids and she was absolutely fine with the bowel. So I thought we are missing out on something. And then we did a food intolerance test for her, and this lady was found to have lactose as milk. And so she was not taking milk, but she used to tell me that I try and avoid milk and milk products because it doesn't suit me. So she probably knew that. But she used to have a cup of tea, which I had the milk. So that also used to worsen her thing. And she had the food intolerance to groundnut. So she used to cook food in groundnut oil. So I just told her that if you have this report, might as well try and change it. So she stopped cooking in groundnut oil, taking groundnuts, and she started avoiding milk in all forms. So she used to take the soya milk if required. And there was a remarkable improvement in her GI symptoms. So currently she is asymptomatic. She used to see me nearly every 15 days. And now she visits me 6 monthly, 8 monthly. So that's a difference. So I think that we do need to look at food allergies, especially in these patients. I don't have any experience with the genomic aspect, but food intolerance is a big problem. And a lot of patients who come with GI disturbances labeled as IBS or IBD tend to have actually food intolerance.
And if not fixed at that point, I think eventually autoimmune.
So how the diet pattern starts? Genomic report tells me a pattern. You have caffeine, alcohol, all this. Now we call them a designer genes. Like somebody can tolerate two drinks of alcohol, somebody can tolerate 6 drinks, but finally we all know alcohol behaves similar with each and everybody's health. But the tolerance level is very, coffee also. We all know that how coffee behaves with each one of us, 1 drink, 2 drink. So all this tolerance can be checked with genomic report. And food intolerance, the challenge generally is there are a lot of foods which to be deleted in your diet. And the patient is left confused. But if you look at the food, they are mostly proteins. They're either corn, they're dairy, there are wheat, the gluten in the wheat. So then, to be more specific, the experience which we have with this genomic report is at least gluten. Gluten, the challenge is I think the genetic mutated variety of wheat which is coming in our diet. Dairy is over drinking of milk. I think the milk of a child starts at 500 ml in the morning. So definitely a lot of xenoestrogens in that. So this contributes to a lot of impact on your digestive tract. And hence I think the body is busy doing it.
Someone who is allergic to wheat or dairy, what if they change to something which is more natural form instead of like genetically modified variety or hormone induced?
Definitely,
Any difference?
Geeta, but there is allergy and intolerance also, right? Answering her question. Most of your allergy tests will be IgG, IgE.
IgG.
But then your intolerance, what you're checking is you're sending your.
Correct. So there are elimination diets. We'll talk about it. Just hold on so that we take it in a sequence. So we keep this topic here and then we get back to this. So what happens is we are talking about mind health. So gut and mind is related. So we talk about intolerance and all that. So when I know my genetics, when I know my MTHFR ratio, COMT ratio, the genes here, the dopamine genes, I go back to my neurotransmitter production because we've been talking about serotonin generation, dopamine generation. And I know that if my body is deficit or is genetically variant in a MTHFR genotype, then the folic acid supplement may not work here. I need folate. So B12 deficiency, it has a lot of answers to it. So SAM supplementation, the homocysteine race, uric acid. So one folic acid metabolism has so much to tell me, right from mind health to my inflammation, hyperuricemia and everything. And that folic acid should be folate, pyridoxine and methylcobalamin. So this is how I start looking at the combination with this MTHFR report, and that can be given as supplement or as food because folate is best available in the food. And then if I look at this from the nutrient point of view, this is a wonderful tool to understand as simple supplementation or through the fortification or whatever. I can look at this nutrients where I know that there are a lot of cofactors, B6, B1, B3, niacin is when you say there's a lot of heat generation, a lot of energy production, stress is very high, what does it mean? It means energy levels are very high. And for 1 ATP, 1 glucose to 38 ATP, you need so many cofactors, you need so many nutrients to make it work. So a B complex is an integral part of your energy metabolism, the Krebs cycle, the glycolysis, the oxidative phosphorylation. You need magnesium, you need iron, you need selenium. So I think, are we not looking into micronutrient deficiencies in the food? Because soil is very poor in micronutrients. And because of micronutrient deficiencies, maybe a lot of natural mechanism which your body should have. We're all facing challenges with it. We need to answer it. They're very simple tools which I'm going to talk about it now through food. We'll learn about it. Step 1 is always work on preventive measure, food as a tool, not to jump to supplementation, and then we can look into it. So this is how the genomic report looks like. Like they have the circadian rhythm gene, they have metabolism ADBR gene, they have the FTO gene. FTO gene is highly studied for obesity. So your attitude towards food, like people say that I eat very little, still I gain weight. All that can be mapped through your genomics. Right? Again, it is a tool like the microbiome. At least microbiome can be retested. But genomic, I think, is only one-time test where you need to really work on epigenetics and it should help you. So the whole goal of this thought process is, yes, we need some answers. We can't just talk about looking at mindful eating without thinking that what goes behind it as from nutrient point of view. And I thought this micronutrients, this kind of a gut flora is very integral part. to make you understand that I need to work on it.
Geeta, how do you read that report?
So it is like vascular health. ApoE, then you have E2, E1, E3, then you have neutral isoforms. So your neurodegenerative and vascular changes are normal. Then you have inflammatory TNF gene. So you have normal, so they've made it easy for us to understand. So your inflammation is not, so TNF is normal. But you have IL-6, you have CRP also. So one gene doesn't talk about everything. You have a collective gene, you say thyroid, then they give all the genes which are responsible that for people like have thyroid function test. Also, this is the obesity panel. So for obesity, whatever they felt was needed, they have put it in, they have clock gene, they have MC4R snacking gene. So this is how we read it, and then we need to conclude it through the interpretation.
How do you interpret that as a dietitian then?
So we counsel the patient. It becomes a placebo report for us. Suppose for this patient, like we've started with discussing a 23-year-old boy, and suppose let's say this is his report. He comes to me with frequent snacking and volume eating. So then I say, see, what your genes tell is you're good on most of the area, but your insulin resistance is poor. So you eat a high carb meal. We need to change the pattern of your diet. We need to add fiber or something like that. You are not very great with your metabolism. The ADBR talks about metabolism. You need to have the neat calories and the exercise to support your metabolism. You can't escape from not exercising or not hydrating, the food which helps you. So this is how I interpret. Plin is a gene of fat storage. So adipogenesis is very high in that person. So the nature of his metabolism, the nature of how the body behaves with food can be reported through your specific genes which are reported here. This is a little raw report, but now the detailed report are coming in a very beautiful manner where it's more patient friendly because this is
also a blood report.
It's a blood, as I said, genetic report. So it can be hair, sputum, anything.
Just one thing that MTHFR gene what you showed, that is a very important gene, especially when we are using some drugs like methotrexate.
Correct.
So pharmacogenomics is a lot influenced by
Correct.
those genotypes.
Very
How we really respond to drugs is also determined by our genotypes.
Agreed.
So that gene plays a very important role.
So
with
simple
our drug
MTHFR has a lot of answers to our questions. For us, uric acid, homocysteine. Then we correlate with lab reports of homocysteine. If you're hyperhomocystinemia, that means you need more of folate. Then you do your MTHFR.
The gene is integrating obesity, inflammation,
Perfect.
immunity all together. So it is actually the gene which will tell us the whole TNI if we really do that.
Correct.
And the monogenic form has different treatment, but in the polygenic form of obesity, it is one of the key genes, the FTO and the MC4R.
So we're thinking differently. We know that food plays an integral part, but we are looking at tools which can help us to work on a precision nutrition because we are in an era of personalized and precision medicine and nutrition, and that is why I thought this should help you to more explore because this 3 hours is not enough. Nutrigenomics, one thing needs a full session to help you understand. But yes, these are the tools, but it is not easily accessible. There's a lot of less awareness. The costing is an issue. The data is an issue. Indian data is not available. So it is a challenge for a dietitian to mix and match the report, the doctor's interpretation, the patient's feedback, and come to some kind of integrated way where we can look at it. So few tools which you can use and which are researched and observed that yes, the gut microbiota can help us to personalize the prebiotics in the diet. At least we can pick up that. You do need for serotonin as the 5-HT amine supplement, which 5-HT amine definitely is a precursor for your serotonin. The NAC is a precursor again for your B12 metabolism, the methionine. Then you have the gut biosis, and elimination diet is a very easy way without doing any testing. 5 things to eliminate. Generally, this is what an Ayurvedic says. When we say that we want to detox you, what is a detox? We'll talk about it as we come in. So elimination, all the food which is difficult for the body to digest, we eliminate. But we don't say that for life, we gradually start replenishing the gut flora. Like you say that in Ayurveda also you have few. The detox diet in cosmetic, where you have this diet programs is very risky. They just give you some water, salt water, jeera water and all that. That's not detox. The detox is about looking at food which is difficult to digest, gluten, dairy, processed foods. All these 5 different areas we look at it, the non-vegetarian, because we do feel that non-veg creates a lot of stress on digestion, the spices and condiments, the masala foods. All these are foods which we try to eliminate 5 of them completely. We stop for 2 weeks. Then second week, once we observe the symptoms, we introduce 1 food. then we introduce another. So this process of 3-4 months, the patient can do it without testing anything, and you can self-observe it. So elimination diet is a very interesting tool in most of the IBDs and other areas of gut intolerance. Tryptophan, we all know, and we'll talk about it soon. Pre-probiotics, GABA, sir was speaking a lot. We do have glutamine-rich food. Glutamine is a very important precursor for this. These minerals are very much studied in mental health, and B6, B9, B12. These three are again major nutrients which help in your lot of areas from gut to the mind. So why not look at this nutrients as a tool? Food, supplementation, and water soluble vitamins. So I think there's no harm in giving one supplement of B complex to each one who wants to work on himself. Because at the end of the day, every patient who comes to us wants to work on it. He knows he's obese, he knows he has to work on himself. The challenge is the adaptiveness, the challenge is the maintenance and his compatibility to our instructions. So somewhere, if I use small tools, small changes, and nutrients can become a very interesting tool, which again from a medical point of view, patient is open to accept it. Vitamin ki goliyan hai, so he can definitely take it. So for tryptophan, there is a science that neurotransmitter, serotonin, GABA, dopamine, all this can be held with some kind of a precursors. Glutamine, tryptophan, tyrosine, all this definitely can be worked with few foods which are rich on those precursors. And we not only precursors, but we also need facilitators. So it's not enough that B complex or protein is given. I need to see that I have my facilitators. Anemia is a very important marker. The iron is less. It's such an important facilitator for so many integral reactions. Zinc, your B3, B6, vitamin C. So I think end of the day, magnesium, zinc, all these are proved. They are micro, ultra trace nutrients. Is the problem with bioavailability or food is not, B12 is just 2 micrograms. And we take 500 micrograms of supplements. RD is just 2 micrograms. My gut is not making B12. Something I think we need to look at correcting the gut flora first, looking at a good diet so that the absorption bioavailability is better. So somewhere I think it's introspection where I need to know that how do I reset my health, my metabolism. Mental health is a part of it, NCD is a part of it. So now we know that tryptophan has such an important role. It's an essential amino acid at the same time. We spoke about BDNF. Tryptophan can change your BDNF. It is a precursor for serotonin. It does work on melatonin. So a cup of milk at night helps you to sleep well because milk is rich in tryptophan. Then it's a precursor for niacin because niacin is an integral part of your energy metabolism, B3 vitamin. It's a gut flora and it's an essential amino acid. So a simple nutrient tryptophan also can do. And tyrosine is a non-essential amino acid where we also can, because phenylalanine is an essential amino acid and phenylalanine is converted into tyrosine. But with this emerging emotional challenges, mental health, tyrosine has gained a lot of importance. And you will find a lot of supplements in the market, dietary supplements of tyrosine at the same time. So why not? They are all amino acids. We can try, we can think of it. If they can help in working on emotional health apart from food, I think that's a good tool for us to work on the mind. So yes, there are foods, and if you look, they are all amino acids. So definitely a protein is important. But I said that high protein is not what. So we have to define protein, we have to understand what is a protein and how much. Quantification is, I think, the need of that, because this is not new. Protein is not new for us. How much and how do we manipulate and how do I get the best of every amino acid which my body needs is what we're trying to look at. So there are definitely a lot of studies on food and mood, vitamin D, probiotics, ginseng extract, fish. So somebody was saying that in Calcutta, there are very less cases of depression. I think ma'am was saying, Alka ma'am was saying about some Calcutta food. Is fish a contributory factor for that? We do not know because there's a lot of studies. So we all know that yes, food, antioxidants, Japanese diets, elimination diets, somewhere where not much wheat is there. Now we're making rice as a superfood. If you start gradually looking into it, the rice industry is getting on into a better way of looking at your gut than wheat. So start looking at nutrients in improving your gut health and as a precursor for your mental health. So SOD, this is a superoxide dismutase. It's a very potent scavenger or detox agent, right? So if I have good vitamin C and vitamin E, it will help me to detox better and have a very good antioxidant level in my body. The challenge with today's diet is very high amount of N6 compared to N3. So all the information which you look into your patients' area, especially the NCDs, it's a very poor N6 N3 ratio. Any inputs on that? Anybody has thought about it? N6 is all PUFA. Your vegetable oils are N6, right? Your food pattern, whatever we eat, from morning we've been eating only N6. N3 is a lot of vegetable fat. The fat which is present in the food is N3. And specific fish, not all fish have it, salmon and specific fish. This is a typical ratio of N6 because N6 is a pro-inflammatory nutrient. N3 is an anti-inflammatory nutrient. The allowed ratio is 5:1. Our diet has more than 10:1 ratio because you hardly consume any amount of omega-3. Either you consume omega-3 or reduce your omega-6. So somewhere the balance of N6 and N3 is a very integral part of your inflammation control. And we have to start looking more deeper into the dietary recall to understand what is going on. Yeah.
Nuts and seeds has
Sorry?
Nuts and seeds.
They have N3, yes. But again, the calorie you are allowed. See, you have your ICMR guideline which tells you how much to eat. Milk 300 ml allowed, 2 fists of nuts allowed. So in an adult, it is definitely mentioned 800 grams of vegetables per day is the allowance which the Indian guidelines tell us. How much of us have it so much? We generally don't. Then you don't get into deficiencies. 800 grams of vegetables, 100, 200 grams of fruit, 2 fists of nuts. So it's a balance way of looking at then the gut does the work. No? The viability increases with the prebiotics and it helps. This is how you start looking at it. With this keto diet,
Classic anti-inflammatory diet.
we'll talk about it. All the diets are coming. The diets are coming. So folic acid, B12, D3, polyphenols, folic acid, I won't go into deep of that. So end of the day, till here, what is the interpretation now? I want the audience to tell me. You've looked at food as information. You started giving a different relationship name with the food. You took a gut feeling as a very integral part of your mind. You'll eat what suits you. The third is we spoke the role of nutrients in improving your mental health, gut flora and all that. So any one of you would like to interpret it, what did you feel after reading all this? Sir? Then we take it ahead.
Actually, madam, बहुत सारा चीज पच नहीं रहा है.
सादा खाना है सब दाल चावल रोटी सब्जी.
I want to just go few 100 years back or maybe more than that. एक जमाना ऐसा था कि आदमी कुछ खाने को नहीं मिलता. One time that we don't have any food to eat. एक ऐसा भी टाइम रहा होगा जब अपने पास maybe ये झाड़ होंगे सब जिसमें शायद गेहूं के होंगे कुछ चवड़ा के होंगे लेकिन उनको पता नहीं था कि ये खाना है. ये टाइम से human may have started. He may be just eating fruits from the trees and all these things. And then अब यहाँ से चालू होता है कि अपन ने क्या खाना चाहिए. Maybe he was doing that शिकार and then eating animals and all this. अगर वहाँ से किया जाए तो predominantly we were non-vegetarian at some point of time. Everyone, if we are considered as an African origin. वहाँ से अगर डाइट चालू करते हैं और देन फिर जो ऋषि मुनियों का जो अच्छा डाइट था that was a fruit based diet and maybe and this milk. फिर ये सब होते हुए वो 100 साल जीते थे और यहाँ पे अपन N3 N6 की बात कर रहे हैं. उनका कहाँ का N3 कहाँ की सालमन फिश खाया होंगे उन्होंने क्या नहीं खाया होंगे I don't know. But something is missing here.
Process industry has come up in a big way. Soil nutrition has been depleted. There's overproduction of food. Supply demand has changed. So there's a lot of engineering which has come. Food engineering has come into the market. Convenience, comfort, happiness has been associated. Survival was associated with the food. Today, convenience, comfort, and happiness has been associated with food. So there's overeating, overindulgence. So there is no starvation. Today, you have to force yourself to go on a starvation. So the environment has completely changed.
Actually, you have a very percentage लोग ज़्यादा खा रहे हैं. अभी भी इंडिया में बहुत सारा percentage
nutrition. But अभी we are talking NCD here, so it's all about food waste.
No, you have very good point.
Wrong eating also.
I just would like to add one point here. All this research has been done in Western countries. and they have been funded by companies like Monsanto, which is producer of 90% of genetically modified soya. That's why there is a lot of soya, tofu, and all these things. Even the salmon.
Soya may be
and all
harmful sometimes.
and like if you will see, there is avocados there, all the food there is a very less research done in Indian aspect. So we cannot generalize. I know modern science like to generalize, standardize everything, but here we have to look at there is this limitation when we are interpreting it.
One of the findings are that everybody this wellness clinic. Yeah.
Take the mic. Take.
You said that the Rishi Muni जो थे उन्होंने like they were healthy, they lived for 100 years. So one of the reason for their longevity is the food they ate. अभी मैम ने जैसे gut health की बात करी, the food they ate was high in fiber, and that fiber is a probiotic and that will take care of their good gut health. अगर आपका microbiota अच्छा है, as we सी मैम ने भी बताया है कि गट का कनेक्शन जो है ब्रेन के साथ है, गट का कनेक्शन हर एक सिस्टम के साथ है. सो इफ योर गट इज हेल्दी, द अदर थिंग्स विल बी हेल्दी. देन मैम ने लैक्टोज इंटॉलरेंस की बात करी, जो अब है पहले नहीं था. मीन्स कि वो ऋषि मुनि भी दूध पीते थे. सो देयर वाज अ कैच इन दैट कि जो दूध हम आज पी रहे हैं दैट इज मोस्टली A1, जो जर्सी काउ जो बाहर से आई है, जो हमारे यहाँ की गिर काउ है A2, यस A2 मिल्क, उसका जो प्रोटीन है that is easily digestible and that doesn't cause any problem to the gut. It is gut healthy, gut friendly. So the problem lies mostly with the westernization. हमने अपना कल्चर छोड़ के वो वाला कल्चर जो अडॉप्ट किया है उसकी वजह से. अगर हम फिर दोबारा से अपनी रूट्स की तरफ जाएंगे तो आई थिंक ये मेरे को लगता है कि that is one of the solutions.
I agree with what you said. That is one aspect of food. If I am talking as an endocrinologist, I can tell you why things have changed. The intrauterine environment has changed. The epigenetics has changed. The maternal nutrition has changed. Then the genes which are responsible for food and metabolism have changed. The gut microbiome has changed. Then the stress levels have changed, the exercise activity has changed, and all this affects your food choices. So I was telling you that there are many things which decide what food you eat. So it is not that only food has changed. Lot of things have changed, and we fail to understand that the mother who is giving birth to a child herself is malnourished in many aspects. And that's why the conditioning of that fetus has been in such a fashion that the folate deficiency is going to be inborn. The gut microbiome is going to be different. So I think it's a question. I have not included endocrine disruptors at all. I'm not taking environment and climate change into that, pesticides into that. So that's a big branch which is beyond my control.
Also correlating the things with the gut and food and the gut.
Yeah, so I agree with what you said, but I'm trying to answer Sir's question. That what has changed over years? So there are so many things which have changed over years, and there is something called like genetic anticipation. You find that every generation is getting unhealthy in terms of their genes, in terms of their metabolism, in terms of, you see so many childhood obesity. I don't think you must be seeing in your days. You see so many, you can say, diseases of adult coming in younger ages, like diabetes is coming even in the adolescence. So I think there is a lot of genetic change due to these environmental and the hormonal factors, along with the psychological changes, changing all these things.
2 points I would like to add on. Yes. One is we don't know actually whether those Rishi Munis are actually surviving for 100 years or not. Okay? So we don't know, and we always talk about longevity.
They could have done other diseases, not NCD.
Yes, you don't know. So I mean, we are always talking about our life expectation increasing. So I think we should give some credit.
One thing is definitely related with longevity: not eating.
Yes.
Not eating and fasting has been proven to be an important technique for improving the telomere length and longevity. So the lesser you eat, the better it is, whatever you eat.
And that's the second point which you yourself were pointing out is with gene. Okay, we were hunter-gatherers, and our genetic makeup was in such a manner that we had to accumulate things in our body and keep it for that difficult hour for ourselves.
But this day we are carrying the same gene, but the environment has changed. Okay, so we are going on accumulating that within our body where we have, sufficient amount of food around us.
So not only food, many things around us have changed. Yes.
And one more thing, ma'am, what has changed that I feel very few people eat when they are hungry. It is all the time they eat when it is time to eat.
That is called
So
hedonic
they
eating.
don't have that feeling of hunger. We have lost, we don't understand that I am hungry and now I should eat. They don't wait for that feeling to come. So it is 8 o'clock, it is in the evening, I will eat. I will not ask myself whether I am really hungry or not.
अरे मैडम पर एक और प्रॉब्लम देखते हैं कि जब है ना लोग बहुत ज्यादा इरेटिक रहते हैं खाने में, उनको भी एसिडिटी के बहुत प्रॉब्लम्स होते हैं क्योंकि उनकी इतनी कंडीशनिंग हो चुकी है कि 8 बजे यदि खाना नहीं मिला तो एसिड तो सीक्रेट होना शुरू ही हो जाता है.
So eating is of two
So
types.
it's a really very crucial kind of ये कि मतलब टाइम पे खाना चाहिए या irregular खाना चाहिए.
हम बात करेंगे rhythmic eating के बारे में.
Madam is going to talk on that. But two things is that there are two types of eating: eating for hunger and eating for comfort and pleasure. That is hedonic eating. So hedonic eating is a eating type which is to satisfy any hunger. So if a person is thirsty, he will eat. A person is hungry for love, he will eat. A person is hungry for attention, he will eat. You understand? So any कुठलीही भूक भागवण्यासाठी जेव्हा माणूस खातो, that is hedonic hunger. So you eat when you go home is not because you are really hungry. You feel comforted. The calm supply. I'm done with my work of the day. You may not be hungry. You will eat whatever comes your way. Then you'll have a proper dinner with your family. You understand? So this kind of eating has changed over time because of stress and psychology and many more things. But eating for hunger and what Sir was talking about introspection and inner senses feeling, whether your stomach is really feeling full now. Like she said that a lot of people ate the doga and coffee in spite of having a heavy lunch. I'm sure nobody was empty stomach. So there was no need to eat. But it was hedonic hunger. चलो है टेबल पे अच्छा है तो why not? किसी ने ये नहीं सोचा मैं गार्बेज डाल रही हूँ. You understand? So it is something which is going to harm you. It's going to get converted into fat and antioxidants, having more calories. So ये सोच के कोई नहीं खाता है. So there is the need for mindful eating. You have seen that in old times there were no television. So television के सामने बैठ के खाना, screen के सामने बैठ के खाना. All this has increased because you are hardly mindful. You eat 3 chapati, 4 chapati talking to a friend. You understand? You don't realize that you finished the whole plate. So there are a lot of things which have changed over time. Our socializations have changed. Nuclear families have come. Loneliness has come. So comfort eating has increased.
Zomato and Swiggy.
Actually, one point.
Zomato and Swiggy, I think they are the two major
Contributors.
which are going to contribute to huge pandemic of obesity and associated CLDs. We are seeing a lot of CLDs because of obesity. There's one more point here that our social norms have changed. Our life, our socializing revolves around food. Now you have to meet a friend, let's meet at a cafe, let's meet at a restaurant. You never say let's meet in a park. That's one thing. The second thing is that yes. The second thing is like you have to organize a function. Like we just saying that Vishali was worried that the food should be good. We organize a function. And the first thing we tell the caterer is that food should be good because people should not go back and say, वहाँ पे उन्होंने खाना भी हमको अच्छे से नहीं खिलाया. So it's like, so what happens? Everything revolves around food, and that probably is one of the reasons why there is a huge upswing in obesity over the last 30 to 40 years. I think that's what.
And I'll add to this point that the adolescent and childhood obesity actually is a result of this. The mother's love is compensated by food. Mother goes to work, the dadi feels that no, बच्चे को प्यार नहीं मिलता है माँ का. वो खाना खिलाती है, and that is
YouTube videos, phone पे YouTube videos.
नहीं, that too, no, there is a sense of guilt कि उसकी माँ घर में नहीं है, बच्चों को नहीं खिलाएंगे तो क्या बोलेगी? समझ रहे हैं? I've seen so many childhood obesity because of the grandparents. The child is obese because माँ खाने नहीं देती और दादी बोलती है बच्चे को कुछ नहीं मिलता है, माँ का प्यार भी नहीं मिलता है, वक्त भी नहीं मिलता और खाना भी नहीं मिलता है. So all the three. So
one point actually I would like to add is content of food, nutrient content of the food has changed over the years. In 1940s, the amount of iron we were getting from 100 grams of spinach, if you have to get that amount of iron, you have to eat 1 kg of spinach nowadays. So the system changed. So when we actually came to India, our first thought of we are going to grow our food. So we started growing our own vegetables. We have like our cows, everything. So it was like kind of crazy thought, but food is core to everything, core to life, and we are focusing on host factors more. And not where it's coming from. So we have to see that how agricultural practices, food industry practices, it has changing everything. So when you have this like entire picture, then you will give your answers why you
We
see
will
this.
have answers for all this in this coming slides. So, comments well taken.
Tea break, please serve. So if anyone is feeling guilty about having a total coffee, then tea break cancel that. Otherwise, we can go and have
I read a very interesting small paragraph in the Natural Geographic about the importance of seafood and fish in human evolution. What it correlated was that most of the human civilizations they evolved. I mean, they evolved and they became more stable. Yeah, around rivers and near the oceans. Yeah, and this they say that eating fish was the key dietary change that allowed the human brain to make a jump, in the evolutionary development. So that is what last year I read it in last year's National Geographic.
But that talks about omega 6, omega 3. Okay, tea break after listening to so much. So let's answer these questions.
Okay, who wants to take tea, please go.
So, we made comments about existing scenario, helplessness about how to work on the scenario. Nothing is going to change. Swiggy is going to be there. It's going to dominate. Comfort is going to be there. Hospitality revolves around food. Nothing is going to change. So let's find answers. Right? Today we are here to work on answers. The answer, first one I would say, is appetite and satiety regulation. We are going beyond our appetite capacity. We all know the stomach size and our intent to eat. So with these two exercises, if you have if you have introspected, you have to learn that मैं कौन सा खाना ज़्यादा खा सकती हूँ या खा सकता हूँ. Let me give you an example. If a child comes and say 2-minute noodles I could eat, how much can a child eat or you can eat for that matter? The bowl size bigger. Dal chawal, same quantity can, I doubt. Generally with the processed food, the breads, the sandwiches, the food which comes with ease, comfort, especially the cornflakes, bowls, mueslis, sugar added, salt added, processing, they release a lot of pseudo-dopamines. They change your appetite, they change your satiety. They make you eat. घर का खाना इतना नहीं खा सकते जितना हम बाहर का खाना खा सकते. Do you all agree with me?
Yes.
Right? So step one for every person we have to work is on appetite and satiety. Let the stomach and brain do the job. No, the industry is not going to change. The environment is going to become more worst. So let the stomach and brain do the job. For that person, he doesn't want the solution of saying do not eat. 23-year-old boy said, I am going to expel of the food. हम लोग control नहीं कर पा रहे हैं after 3 days of mindfulness. So how do we expect people to change? Right? So the change is in adaptation to work on appetite and satiety, regulated your mind to work on a typical satisfaction level. So how really you should eat? Should you eat quantity or quality? How many of you feel overeaten after any days of meal here?
All day.
So it's mindful eating, autonomic drive to do good. So post-meal feeling overeaten is guilt, feeling terrible, and immediately after eating I've heard a lot of it, आज रात में मैं कुछ नहीं खाऊँ. We declare after eating that feeling and senses, and then we say we're not going to eat anything. For dinner ready, so time stomach empties faster, and you go back and see. Oh, and you first do a survey of what is good, and so that's a buffet challenge, and then you eat. So the challenge is again, the brain is not trained to say no. The brain is not trained to say. So we need to work on how to actually work on these few tricks, few tools, not changing the way, adaptation to that tools. Food order sequencing, and that's what we did in 2 days. That we started there, and there is research and proof that if you start looking at appetite training, many of us know our appetite. And for me, when I ask my patient, I ask how much pav do you eat with pav bhaji? Paos are standardized in our country. Otherwise, chapati, roti, fulkas, chawal, paos, nothing is standardized. Katori, bowl, and Indian food is never standardized. Indian food's definition of standardization is satisfaction. Peet bhar gaya, man bhar gaya. That is what an Indian food is all about. We can't change it. So first, learn your appetite. The audience here, learn your appetite. Ask yourself, कितना पाव खा सकता हूँ? बहुत भूख लगी है. Smell आ रहा है. पाव भाजी किसको पसंद है? उनको पसंद नहीं, difficult use. Again, the likes and dislikes is a great change for your appetite. So ask yourself, how much pav I can eat? One plate pav bhaji is how many pavs? How many of us feel happy with 2 pavs? लगता ही है. Right? उसके बाद फिर मैं आपको बोलूँगी पुलाव खाओगे? थोड़ा सा टेस्ट करें. It's not important भूख है कि नहीं. उसके बाद मैं कहूँगी गुलाब जामुन आइसक्रीम खाओगे? हाँ या ना? So देखो, you stretched and then after eating this food you said, यार रात में कब? So train your appetite, train the brain where it will say stop after 2 pavs. There are many of them who said that we couldn't eat beyond it. I wanted to taste it, I wanted to eat. We couldn't eat beyond it. How many of you were there after this 2 days of hacks? How many of you felt that I couldn't eat? Anybody? Any experience? First day, water and so things are again personalized. You have to train your appetite. The tool is yours. You have to identify the tool. The tools which are researched are hydration, water, slow eating. Very difficult to eat slow, so we give you a warm beverage. So it's a very easy example to say coffee which is hot and coffee which is cold. Cold coffee, how much can you drink? आराम से. उसके साथ आप सैंडविच भी खा. That's why these outlet, burger outlets and all, they give you cold beverage. Hotel people in a buffet give you, what do they give you? Soup. So training of your appetite is done there itself. So step 1 is look at what trains your appetite. It can be different for each one of us. So hydration, fiber, proteins. That's why did you anytime think about it that when I go to a hotel I first given we go and order. First क्या order करते हैं? नहीं. पहले पानी पिलाते हैं. Anywhere घर में भी कोई आता है तो पहले पानी पिलाते हैं. Then you say soup. Then you say starters are generally starters. Chicken, people eat chicken, paneer, mushrooms. So it's protein. And then the waiter says order karo. The sequence of food in outside food, even in buffet, banquets, everywhere there is a hydration, starters, salads, and then the main course. Training your appetite is what the reason behind it. At home, what do we do? Roti ya chawal and mindful and mindful. When you start with a carb, you can eat too much. So start always with these tools which will be noted here. Protein, fat, because there are science and research saying it impacts the secretion of your GLP-1. It definitely gives the food order, impacts a lot on your appetite. And that's the only tool which we can change in our body. We can't change the environment. Any comments on this?
ये भी पता नहीं है.
क्यों
पहले लोग दाल खिचड़ी खा के ही रहते थे, सब्जी रोटी खा के ही रहते थे.
सर आप क्या कर रहे हैं? एनवायरनमेंट को पूरा बाजू में निकाल दे रहे हैं. You are not looking at environmental factors. आज प्लेट एक्टिविटी नहीं देख रहे, भूख नहीं देख रहे, एनवायरनमेंट, फूड चेंजेस, खिचड़ी इज अगेन दाल चावल सब्जी, राइट? सब घर का खाना. अभी की खिचड़ी इंस्टेंट आती है, गर्म पानी में मिलाया, बनाया और खा लिया. वेरी फ्यू पीपल. I mean, I'm not talking in your house. I understand what you're trying to say. We're coming to the food combinations also. First, I'm going to talk about how to train appetite. And if you observe that your appetite is larger and you want to shrink, the problem is expenditure. No, we are not able to move so much. Either you eat less or move more. The choice is yours. It's not the exercise. Exercise is different. It is the non-exercise activity which we are talking about. So if your need is less, then you have to start looking at I need to eat less. Calorie intake and output is what the NCD and the chronic illness is all about. So can we start looking at it? And if you look in an environment where it is social, it is that way. For every alcohol, they give you cheese. Do you agree with me or not? Yes. Cheese in wine parties, they don't say wine in cheese parties. Do they say? So first cheese and then wine. Why? Cheese is protein and fat. It delays gastric emptying. It induces early satiety. Your limitation with the drink becomes easier. Right? So, can you start looking at, if you feel again, this is for people who want to work on their appetite. Not everybody falls in this category. But you have your patients, you have your people whom you want to work on appetite. You can always start looking that day I asked you to have dal rice first, and I made this very specifically कि दाल लोगे बाउल में, उसमें चावल डालोगे, उसमें घी डालोगे. How many of you felt satiated with it? You would have stopped there. It's just the visual appearance of food which made you stretch more. So in a home we can always, and in our culture, at least in Maharashtra and Marathi Khana, dal chawal is always given first food, and that's how the tradition is in our Pongal. So if you want to train your appetite, start looking at how the food is served outside. And start working a typical food order. It helps to eat more consciously, mindfully, and you can stop. Buttermilk we drink after the meal. Why don't we drink before the meal?
That is better.
A few things which you can adapt, you should adapt. Right? Drink water. कुछ नहीं मतलब पानी तो पी लो. And because हम लोग पानी भी पीते ही हैं ना, गेस्ट आए तो पहले पानी पिलाते हैं, खाना नहीं खिलाते पहले. So that is there in our culture. Maybe in a routine we are not so mindful. It only the occasion and social environment. It helps us to work on it. Right? So this is food combining, and Indian foods are wonderful food combining capacity. Problem is we have paid more importance to the main course and we've forgotten the adjuncts to it. Now idli sambar. I want you to tell me how do you have to eat idli sambar. Early satiety, we are looking at appetite and stuff because I'm saying protein, fiber, fat, important. Carbs last. Isliye sweet dish is always at the last. Right? So suppose you want to eat idli sambar. Because idli comes with sambar. Idli chutney is a very wrong idea to eat. Idli has to be eaten with sambar because idli is 2 rice and 1 dal. I'm saying protein ज़्यादा खाओ. वो दाल कितना खा के कितना. You can't eat a lot of protein here. So if you say idli sambar, any guesses from the audience? Bowl sambar में idli. हर bowl sambar के लिए एक idli. This is for NCD, not for weight gain patients. So we're not talking about undernutrition, malnutrition. We're looking at appetite training, right? So we have sambar for idli. That's a wonderful food combining. Problem with is upma, or you have poha. Give nothing with it. Jaha pohe is what Puneites eat mostly, right? So what do? We say you first have some milk or buttermilk, right? Or have some sprouts, make it a pattern, or egg if you eat. Then you eat the carb. Don't directly jump onto the main breakfast item, upma or poha, because they are both carbs. And you will realize, we'll talk about that if you eat a high carb meal, if you eat upma or poha for breakfast, you want to eat something at 11. If you eat a medu vada, what will happen? So stomach gastric delaying capacity is very delayed in proteins and fats. The ghee in dal works miracles. It's not ghee is bad or good, it is training my appetite. End of the day, how much I eat contributes more to my energy than to what I eat. So I think what has to be removed from my mind and how much has to be trained. So I need to eat my breakfast with protein and fat because we are all coming in a sedentary activity. We sit for more time. We're learning how to sit here and how to stand, not how to exercise. So somewhere the challenge is the satiety, early and prolonged. If you're feeling at 11 o'clock hungry and want to pick up biscuit, you had a wrong breakfast. Right? You should not feel like picking up a biscuit. Train your brain. Each of one of us know where we are going wrong, and please train your brain. So it is always there in our culture. The problem is we don't. Paratha comes with curd. So eat curd first. Take half paratha, 1 bowl curd. Finish that. Again take half. Eat till you're satisfied. We don't say eat less. But definitely you will achieve an early satisfaction. And second is you won't feel hungry for a long period of time. That always contributes. And there is no special efforts here. Are you on a diet with this kind of an eating habit? Yes or no? You're eating what is made for breakfast for everyone. You're trying to work on food combining principle, which in our Indian culture, every diverse food has this. Except for poha and upma, which is very high way of looking at it. We can always add something, milk or something. This is what I said. But it is there. So, what we need to work on, if we have any person who wants to work on mindful eating, who wants to work as a tool, we definitely can look at screening. Does he really need tools for mindful eating, or it is just a diet plan which works? Because few people are very good, they can follow 100% what we tell them, they don't need all this. But this is a very few sector of population. But most of us are struggling with unmindfulness. The case which we started with is absolutely unmindfulness. He knows he's wrong, but he cannot help it. So such people, I think we can use nutrients as a tool, food order as a tool. We can have some testing done to work on how and what kind of food tools we can use for it. So let's work on very individualistic approach. and it works.
You want to sit and talk?
No, that's okay. I can hear. So that was about unmindful. We're talking about a lot of things here. The second case, we'll take a bariatric surgery case. I've been working with bariatric and I want to just explain my experience because this can be related to a normal population also. With bariatric surgery, what works is the food volume. End of the day, you're eating less mechanically and you feel good about it. But then there are a lot of challenges and the food volume decreases, but the cravings and other areas are challenges. So if you go on a very low calorie diet, if you are on a strict diet regime, a very low calorie diet is 800 calorie diet. You are surrendering yourself to a lot of unmindful eating. The cravings increases, micronutrient deficiency increases, and end of the day, with frequent energy dense food, you end up eating more calories than what you've been prescribed. So calorie deprivation definition is also very important. Satisfaction has to be reached in a calorie deficiency. You can't tell the patient that a powder पी लो वजन कम हो जाएगा. ऐसे बीमार नहीं होती भी वजन कम होता है. Am I right? You eat less, you lose weight. So weight loss is not a great thing. You go to bariatric surgery or you use meal replacement therapies, you can do whatever. End of the day, all of us struggling is how to work on eating less or how to work on mindful eating so that appetite satiety is judged. So definitely there are a lot of experiments done on selective food exclusions. I'll quote 2-3. In some studies where 10 participants were taken and they were avoided with salt-rich foods, wafers and all the processed preservatives, they found after 10 days that there was deprivation-induced salt intake after 10 days. So if you tell anybody, we also observe, do not eat this, do not eat sweets. I enjoy eating sweet. If somebody says, "Mat khao," whole day I'll be thinking, the food focus reaches to sweet. I may do it for 2-3 days, but then it doesn't work. So again, a deprivation, eating less, removing a food which you enjoy from your diet is not a good idea. It may lead to more intake, more irritation, and it doesn't work. So they have tried with rice, bread, chocolate. So diabetics, rice eaters, a greatest challenge. So very smart way I ask them to eat. Any guesses? A South Indian says, "I'm diabetic, I don't want to leave rice." I mean, you're from South India, sir. So what is your observation about your patients when they say, "I can't leave rice"? Or Chennai's the dietitian?
No, see, what you say is right. I am a firm belief that when you talk about diet or diabetes, you cannot bring
There's a mic.
You cannot bring a drastic change in the eating pattern. You cannot say that stop eating rice, change completely to wheat. He's going to do it for a few days, few months, but after that he'll come back. So I think probably what you said is you have to modify what.
Perfect. So any guesses, anybody, that how would you make a South Indian diabetic eat rice?
Brown rice.
Brown rice?
Yes, we can change the variety of the rice, like
Brown
not,
rice.
not always the brown rice, because brown rice is not appreciated by most of the people. Like there are so many local varieties, parboiled rice, which is very famous. And
So why this change in rice? What is the difference between a normal rice? Because satisfaction also we're talking about.
So that will reduce the glycemic index. Secondly, I will combine that rice with a good amount of protein, either with a fish or with a good amount of dal, beans.
Combination.
Combination.
This is a simple way. Very simple is, yes.
No, I personally believe that glycemic index as a tool for diabetic is overrated.
Overrated.
Because what we eat is mixed meal. We never eat rice alone. Rice is always eaten with dal, with sabji. So when you mix up with all those things, the glycemic index comes down drastically. So it's my belief that eating red rice over white rice doesn't make too much of a difference as long as quantity is less. So what I tell patients is that quantity is more important than breaking your head on I should only eat this rice, I should eat black rice. There are a lot of people who come and say I'm only eating black rice. I really don't know what is black rice. Okay.
Sesame rice.
So I don't believe that. I mean, I always tell them that it's fine you eat rice because as ma'am rightly said, the first thing that patients come and ask is, "Can I eat rice?" I say, "Yes, you can eat rice, but watch the quantity you eat. That is more important."
Yeah. So to give this satisfaction, again, red rice, brown rice, individual satisfaction is important because sustenance. If I tell him brown rice, he should enjoy that brown rice. If he says, "No, I've never been like in Pune, we have that Indrayani rice. It is very, very soft and it is very low glycemic index. I mean, it immediately gets converted into sugar. That's not important. What's important, I like to eat it, it gives me that satisfaction. So very interesting way. You can have, don't eat rice in plate at all. Take 3 bowls. As Dr. rightly said, we don't eat rice only, right? I don't eat only chapati, only rice. So I take 3 bowls. I add my accompaniments in my brown. I add my dal, rasam, whatever. I don't change my menu, I don't change my eating practice. I want to work on portions. Plate में rice लेके ऊपर दाल डालूंगी तो, and if I eat a high carb meal, which I'm going to talk about, if the quantity of carb is more in my diet, I'll keep eating. But if the dal and in that rice which you have observed when you ate the other day, the satiety is faster, quantitative approach is easier. Smart way of telling a patient, you can continue eating water, but एक ही चीज करो, बाउल में सब्जी लो, सब्जी में चावल डालो, दाल में चावल डालो, रसम में चावल, उतना खत्म करो, पेट नहीं भरा तो फिर ऐसे ही रिपीट करो. For chapati, it is ऐसे आधी चपाती, एक कटोरी सब्जी. Choice is yours. Eat how much ever you want to. So you're trying to work on glycemic load. And we know that when you incorporate fiber, protein, fat, that's why in our culture we start with ghee rice. Tupid bhat is what we start with because we eat that variety of rice which is very easy to eat. So first we start with ghee rice, we end it with curd rice. But when you say ghee rice, it is ghee mein chawal, curd rice, curd mein chawal. So synonyms also with the food. It's easier to explain to the patient dal rice, ghee rice. It's not rice ghee. So sambar idli has to become, idli sambar has to become sambar idli now. So the priority of the item or the menu can be highly worked. So the problems are what you were saying, that what has changed? The triggers have changed. The gut has changed, the medications. We're all, without taking doctor's prescription, so many of us take analgesics and you don't know the medication influence on our gut. Food industry, visual appearance, happiness, stress, exercise, high exercise person, appetite increases. She will tell us that sports person, you need so much of food. 6 hours of activity every day, they eat huge variety. Once they leave their activity, the appetite doesn't change. They have to work a lot on their food intake because exercise induces very high appetite. So first, if your target is weight loss, go slow on exercise. Because we have to train appetite more than train. So exercise may or may not be, exercise can be yoga which trains the appetite. So if you feel appetite is a problem, and that is majorly a problem, either appetite or snacking. You may not eat more, but you won't be frequently eating. It comes to the same. So identify where your problem is and start working on that. So that is why we'll have the last Dr. Vani talk us about eating behavior, how or we have other psychiatrist doctor talking about how this eating behavior pattern can be inculcated with all this. How psychological tools can help us. I've told you food tools, techniques, format, nutrients, testing, but eating, would you like to summarize? Ma'am, it can come from you also. Eating behavior. Both of you. Something we'll talk about tomorrow. Okay.
Four point bata do.
Okay.
So what I understood nowadays, every time we eat food, we put something in stomach, so we are generating inflammation.
It depends on what food.
Might be, because whatever we are eating, we don't know. दूसरा second चीज what I want to have an opinion about in this August gathering, कि acidity नाम की कोई बीमारी नहीं रहती. Acidity नाम की कोई बीमारी नहीं रहती. सब प्रोटॉन पंप इनहिबिटर का कमाल है. Acid which is a natural secretion, इसको इतनी बड़ी बीमारी बता दी है और ये जो प्रोटॉन पंप इनहिबिटर इतना सारा चीजें कर डालेंगे, we don't know. It may be increased risk of NCD over the proportion of years that we are using proton pump inhibitor. तीसरा point, every time I do all whatever test I want to do about the patients, every time found everything is normal, vitamin B12 और vitamin D कम हो गया भाई, सब ठीक है उसका, बाकी क्या हो रहा है नहीं पता, जमीन से लेके खाने तक. Fourth thing, अभी जो चला चीजें on the gut microbiota and everything. Nowadays, recently some data has been published. Before development of diabetes, that is the endocrine function of pancreas, the exocrine function of pancreas has started prior to that. And this exocrine dysfunction of the pancreas will alter your stool consistency. So like you have said, that we are looking the stool type, hard, soft, whatever, on the basis of maybe microbiota. I am seeing other way that these pancreatic endocrine functions are affecting stool consistency and everything, and that may be precursor of diabetes, picking up that diabetic patient. एक पॉइंट फिर बंद कर दो एंड फिफ्थ पॉइंट क्योंकि भूल जाऊंगा मैं हाँ ये जो अपना वर्कशॉप है ये मेंडिंग द डायबिटिक माइंड है ना सो ये डायबिटिक माइंड क्या है अभी तक मुझे समझ में नहीं है लेकिन व्हाट आई कुड गैदर्ड व्हाट ये अपने को सभी बैलेंस ही कर रहे हैं डायबिटिक माइंड से हटके हाउ शुड यू ईट प्रॉपर्ली योगा प्रॉपर्ली एंड थिंक प्रॉपर्ली पैरासिम्पैथेटिक सिंपैथेटिक शायद ये हो सकता है डायबिटिक माइंड में भी ये सोच ऐसा सोच है शायद कि यू फ्लक्चुएट टू मच आइदर और नहीं पता मुझे एक पॉइंट रह गया कि व्हाट आई रीड फ्रॉम द बर्थ ऑफ लाइफ और बर्थ ऑफ यूनिवर्स कि जब एनिमल एग्जिस्टेंस आया अगर एनिमल एग्जिस्टेंस आया तो उसको कैसे समझा कि ये ग्रास मेरा फूड है तो इट हैज बीन एक्सप्लेन्ड इन दैट डॉक्यूमेंट्री दैट the photons from the sun which are that is fall on rods and cones and these reflection of that rods were taught that this green material which you are eating will be life to you and you eat that so it is slightly difficult आप डॉक्यूमेंट्री देखेंगे तो थोड़ा समझ में आएगा मैं इतने शॉर्ट में नहीं समझ सकता अब हो क्या रहा है कि अपने आइस का जो चैलेंज है कि वैरायटी ऑफ फूड अलग अलग कलर अलग अलग प्रोसेस यहाँ पे कुछ ना और ये जैसे 10 प्रकार के सब रहते बफे में ये अपने अगर मैं सोचूं कि ये फूड का जो स्टिमुलस है ये आग से जाता है सो स्मेल से भी जाता है बट कुछ ना कुछ गड़बड़ हो रहा है कि जो देखते हैं वो खाने की इच्छा होती है और फिर उससे कुछ गड़बड़ हो जाती है आई डोंट नो सर
I just have one comment about the exocrine deficiency preceding endocrine deficiency. That is only in a very small subset of diabetes where you have pancreatic diabetes. But for the major variety of type 2 diabetes we see there is no correlation between exocrine pancreatic insufficiency and endocrine insufficiency. That's just one small part.
So I'll answer this question because I was a part of the fecal fat estimation study in metabolic syndrome. This was a study done by Abbott. And to answer this question, whether pre-diabetes and metabolic syndrome have exocrine pancreatic insufficiency based on some experimental data, and the paper concluded negative, that there is no fecal fat estimation was normal, no evidence of exocrine pancreatic insufficiency, the study was negative. Now there were points in that because fecal fat estimation requires a lot of specification. You need 24 hours collection of that fecal fat. So it was a difficult task to collect that fecal fat. 3 days sample was collected and that had to be stored in the clinic and then it was carried. So there were a lot of logistic issues to that study, but nevertheless what Anish said was proven in that study. So the fecal fat estimation showed that there was no evidence of amylase lipase increase or fecal fat in the stool. So that was ruled out in metabolic syndrome and pre-diabetes. I don't know about diabetic studies if there are any, but there are some hypothetical situations where late stages of diabetes can come with exocrine insufficiency as a part of exhaustion of the pancreatic exocrine part beyond the endocrine part. So that has been proven. So before I go back to Geeta, I just wanted to know the floor. Are you willing for Aarti to come tomorrow and take the exercises? How many want her to come tomorrow? I hope there will be a good sizable amount of population for her because she's asked me. Okay, so I'll ask her to come tomorrow at 7 o'clock, same time. So she'll be speaking on behavior and then we'll take the remaining comments. Yes.
No, it's not a comment. Whatever she explained right now, I wanted to give the evidence about that.
Let us finish her presentation then we can have this.
What I'm trying to do is put out the points which you feel are accepted by you. Not all what we are discussing may be accepted by you. You may not need to train yourself on appetite or whatever. And then maybe at the end you conclude your metabolism, you conclude your eating pattern, your behavior, because it's quite an exhaustive workshop which we are doing. And this 3 hours of nutrition discussion should give you some take back home message, not like sitting and listening to some food industry, because we all know what we are talking, but we don't know the tool how to work on it. So I think today you are taking back the solutions for your eating pattern, where you are going wrong, what you feel needs to be worked on, right? So coming back to what we are looking is evolutionary nutrition. This is what you've been talking about. This is what we've been promoting now, the intermittent fasting. And if you really want to work on cleansing, at certain age we want to reset our system, reset our metabolism. Your patients are open for it. You're very much, this is only for people who have willpower and wants to work on it. So we do have fasting. So first I think you start looking at cleansing phase, because it's a rhythm, evolutionary rhythm. So make it 15 days, monthly fasting. So one, I think cleansing phase. Once you do the cleansing phase, the building phase is much easier. The anabolism is easier after you do the cleansing phase. Suppose you want to build muscles. So immediately don't go to high intensity exercise with your weight training. You go slow. So when you are starting with exercise and you are looking for muscle building in your body, suppose you want to train gym or you do some exercises which you want to have a specific muscle gain, 2-3 days go on a detox system. Detox can be elimination of food, which we just discussed. Detox can be just going on a 2-meal pattern, 1-meal pattern, whatever suits you. You start thinking, how do I detox my body, because I'm going to start exercise and I want to put my body into anabolic phase. So anabolic phase is easier when it comes from a detox, because we all know that the anabolic phase for a body starts in the night, the fasting. When post the anabolism starts, the circadian rhythm, we're going to talk about it. And the last is the sustainable phase. So sometimes you push a little more nutrition because you feel hungry when you do exercise, especially weight training. So that's the time you need to really put a little more food because your muscle needs food, and then you go into sustenance or normal phase. So another small case of circadian rhythm, the last case, and then we start looking at it. There is a lot of challenges in today's era about time management. Time management and how manage. You can't ask the person who's been working in the night shift to eat breakfast and then lunch and evening. Patient will not come back to us again. He wants solution with this.
Coffee and snacks, we can take back. You all are finished with the tea, coffee. Anybody wants to take?
अभी ले लो जो चाहिए.
Yeah, because I think that we are picking it up.
It starts in the evening. Your first meal is coming at 2 p.m. Your second meal comes at 6 p.m. Your dinner is at 10 p.m. You end up junk eating. It's a very common scenario in people who are more into improper sleeping pattern or night shift jobs and all that. So yes, food also has a rhythm. Food also has a metabolism impact. And whatever, I can't change the way you're working. I can't tell you to shift your job. Do not work in the night. Do not eat at so much time. If a person says, I want to socially eat with my family at 10 p.m., accept it. Only if you're willing to do a change which is more sustainable. My personal opinion is, I can't dictate your food, I can't dictate your kitchen. I need to train you to work towards it and self-driven. Maybe with some kind of a positivity, you'll come back and tell me that, okay, I've started eating at 8 p.m. now. I'm happy. This is what I want. Because everybody knows everything in today's world. It's only the internal energy which needs to drive you to that space. So when such kind of a scenario comes to us and I want to work on rhythm, definitely we're talking about rhythm, circadian rhythm, metabolism. So digestion, elimination also has a rhythm. 5 days of a week I eat in an erratic manner. 2 days I don't know when I'm eating. So again, this rhythm of my body is totally surrendered to the environment. And definitely the insulin resistance and a lot of changes in the body happens. So if we master rhythm, we can master metabolism. So if you are facing or if you want to understand how to work on rhythm, I think you can always start looking at it that I will try to understand when do I feel hungry. Step 1 is allow the body to make you feel hungry. The rhythm is always telling you. Because your metabolism is peak. Hunger is a sign of metabolism, a good metabolism. Suppose you get up at 6 a.m. in the morning, it's time to eat breakfast. Get up at 10 a.m. in the morning. Do you need breakfast? So you can't generalize breakfast is important for everyone. And that's what we've been doing. Then you need, it is half an hour to 1 hour after you're rising, your body is in the peak of metabolism. After you're rising. So many people I've seen in night shift get up 8 a.m., eat breakfast and then sleep. So end of the day, breakfast is important. So my job, tick mark, I don't know whether I'm hungry, do I need it? It doesn't work. So step 1 is to set the rhythm. Hunger has to be identified. Most of us feel hungry only 2 times. We want to eat till satisfaction and we don't want to eat anything in between. So respect it. because it's more sustainable. If you listen to your hunger and follow the rhythmic pattern, it is more sustainable because that is your body's rhythmic action. The gut functions rhythmic action. And feeding time is very, very important synchronizer for your peripheral clocks. Listen to your body, how it tries to work. So there is a lot of evidence on chrononutrition, time-restricted diet, intermittent fasting. Lesser you eat, better it is. Every time I eat in food, every time I sensitize my insulin, every time calories. So second hourly is not a very good idea. I think it doesn't apply. It's only in undernutrition, weight gain, or maybe in some scenarios we can look at it. But when you're talking about your NCDs and overeating and all that, I think being away from food is being more supported. So what can be done for this patient? Where her eating always, if you look at a meal pattern, is carb dominant. Each one of us do that. If you sit and write your own diet, breakfast में क्या खाया? पोहा. Lunch में क्या है? 2 रोटी के लिए 1 सब्जी. और चावल पे दाल. The typical eating pattern in Indian is, it is carbohydrate dominated eating. And this is how we are trained since childhood. My mother fed me the same way. She always put rice first and then added dal to it and she fed me. So I'm trained to eat. She always overfed me because she thought food is important part of love and satisfaction for her, not for me, when I was child. So that time, my chronology of my metabolism started. 10 glucose biscuit in 1 cup of milk is a very poor way of looking at the infant meal. When we have to tell them, and a mug of milk in the morning before going to school is another way of looking at a bad gut function. So there is a lot of education and literacy involved in all this. Lesser we eat, better it is the way Indians have to be taught about. Because our focus is not the nutrition, it is more about time, and there's a lot of love surrounded with it. If I don't eat, I don't have a problem, my parents have a problem, or my loved ones have a problem. So I have to just finish that job. I ate for her. Right? So it's an part of education again, where rhythmic understanding of my appetite is very, very important. I'm sure all the audience here would like to now talk to oneself and ask, when do I feel hungry? Are you doing that? And fix that time for your food. Please.
I just want to share my own experience regarding this because recently the studies also, my experience also, I posted at airport my night duty was in. So I could relate with this because these things who are trained individual basis we can apply on ourselves. But the most of person like the municipal corporation persons, like airport persons or security guards, they are working overtime. And that all these kind of diseases, diabetes, hypertension, they are on increase. And one thing I realized that food is not related to one person only, it's about the family. It's not social also, it's family. घर में जो बनता है आपको वही मिलता है. ऐसा नहीं आपके लिए अलग से कुछ बनेगा या आपके लिए वो खाना ही पड़ता है. तो उसके लिए और आपका जब रात को काम कर रहे हैं जिनके साथ में वो आपके लोग कैसे हैं? जैसे ही आपका 1 बजेगा तो चाय पीते हैं, कुछ स्नैक्स लेते हैं, कुछ ऊपर है तो कुछ और ऐसा चकना वकना खा लेते हैं जो भी चीज़ मिलती है, कुछ ऐसा नूडल्स खा लेते हैं. तो दिस प्रॉब्लम इज द इंडिविजुअल तो हम बता सकते हैं, लेकिन दिस इज ए क्रोनिक प्रॉब्लम फॉर द कम्युनिटी और द पर्संस or the workforce who is working there, and they need to be trained on the
larger about the training part. Yes. Again, we are all healthcare providers. Our job is to talk in a language where the patient or person can understand very, very locally and what is available to them. Fiber, protein, carb may not be very easily understood by them. So how do we start looking at it? First, each one of us should be looking at a protein and a fiber. That's okay if you eat yes. First meal, whenever you want to eat your breakfast, your first meal, right? If it's a breakfast is for brunch, first, whatever is the first meal, because your first meal sets in the metabolism. If you eat poha, upma in the first meal, your glycemic load goes up, your insulin goes up, you start feeling hungry, and then the whole 24 hours of your diet and your mind starts deceiving you to eat more food, to eat the food which you want to eat the food which is available. Discipline is very easy if you eat protein, and because the first meal is your breakfast or brunch, depends on what you eat.
What about fruits in the morning?
Yeah, that can come after the protein. You start with protein.
We have a break, but we get up at like 4:35.
So you need to eat
6 o'clock. 6 o'clock we can have only fruits. No?
And then you eat your breakfast, right? At 8:39.
Nuts.
Yeah, so that time you eat your protein. This is a very different routine. 4 a.m., 6 a.m., 8 a.m. is a very rare routine which we are looking at. We are looking at a typical person who gets up maybe at 8 a.m. to 10 a.m. or 6 a.m. to 8 a.m. So this is the range where the person can get up. So if you start your breakfast to eat or not to eat depends on your waking timing. You can't just look at breakfast as a routine because it's been proved by research breakfast is good because the rhythm is not being told in breakfast. So every time I eat carb, I need to understand there's a cephalic phase and insulin response. So that's why I have 2 biscuits with my tea in the morning. I'm ready for breakfast. I eat poha, I'm ready for tea and breakfast. I eat chawal dal khaya ya roti, 2 roti and sabji are typical. I'm ready to eat the evening. Some snacks. My mind drives me to eat something and I want to eat something. A very good tool is change your breakfast pattern. Vegetarians can go for chillas, eggs, small cup of milk, 300 ml of milk is allowed. We can have milk. You need calcium. It's not that you should go off dairy. The problem is overtaking dairy intake. So if anybody has intolerance, that's a different story. So if you start looking like the first meal, if I tell her, you double your dal, you double your sabji, or you eat, if patient says मैं चावल नहीं खाती, so एक रोटी को 1 कटोरी सब्जी 1 कटोरी दाल, ये खत्म करो, फिर और 1 कटोरी रोटी. So somewhere you try to change the glycemic load. But the first meal has to be double proteins. It really changes your next 24 hours of your mind to tailor make your everything everybody knows. But then at that point, if my mind was to say, do not eat, it's not good for your health, I want my body and mind with disciplined eating. So again, coffee. Coffee increases cortisol. It drives you to eat more. Right? Depends on how much coffee. 2 cups allowed. Again, coffee tolerance and intolerance is a difference. So somewhere, if I start looking at a peak hours, introducing good amount of proteins and fiber in my meal, which I can do with a routine diet, I think it helps. That's a dietitian's job, to help the patient to find out what are the healthy protein and fat. Dal is also a protein for me, right? Size of the meal. And tell the patient, this is the volume you should eat. You're overeating. You should be very blunt in talking, because once I know how much he's eating, I should tell him, first I only have to regulate your appetite. Then I'll see about what to do with your diet. First, let's work on appetite. First job. Second job, avoid snacking. Don't work on food and anything. Eat everything, but don't eat in between. So I think these are small steps which we can do. We can start with multivitamins, start with hunger and satiety, look at rhythm, and as somebody said, I think Shiny said, that redesign the timetable. And sit with the patient, and as per the patient or the client or us, start, or you can do it yourself, and redesign the timetable. You set your exercise time, you set, that's very important. Then I think do's and don'ts come into the function. So very beautiful way of looking at metabolism apart from textbook definition is, along with chemical reactions, I think I should believe in myself, my gut, my feeling, my adaptations. I'm a non-vegetarian, but today I don't feel like eating non-veg. Believe in yourself. Don't push too much of proteins, because your gut is telling this protein you can't digest, do not eat. Accept it, right? So that's the metabolism. Setting your own metabolism is very, very important. And I think that's what is the SAD diet is promoting. SAD, anybody knows what a SAD diet is? It's a standard American diet. So SAD diet. A lot of pizzas and burgers and all this which has come from that Western country to us. It's a SAD diet which makes you feel drained. It's the process, it's the refined food, the sodium, the salt. HFSS, Eat Right movement in India has come up with HFSS. They said high fat, high sugar, high salt to be avoided. Very few of us listen to that, because we need a lot of individualization, application of food training. I call it as training. Train the brain to work on it. And yes, there are, like we talked about, functional, mushroom, chlorella, magnesium works in a wonderful way. Anti-inflammatory, gut resetting. Mediterranean diet, I would say more of sattvic diet here, a lot of vegetables. Mediterranean diet talks about veggies and nuts and good fat, right? So there we are. So end of the day, I think we are looking at how to control the areas which you want to work on. Each one of us doesn't fit into this category. But if I start looking and identifying the root cause of my health, my job becomes more and more easy. I need to minimize the ROS, I need to minimize the inflammation. I need to minimize excess of food in my body or the snacking which is coming from salt and sugar. So somewhere I need to look at pranayam, taking a deep breath, oxygenation, because we know that food and oxygen is calorie burning. So again, a small tip for your patients, take a deep breath before you eat food and see how it changes your attitude towards that portion or any food. Or it helps you to digest the food better. It have an improved metabolism, because there is definitely a research saying that good oxygenation improves your aerobic quality and definitely helps you to improve. What is metabolism? Burning of food is, calories is metabolism. So definitely we'll have them talking tomorrow. Digestion begins in mind. And we want the experts to talk about this tomorrow, that how really creating an understanding of brain's role, because they're experts here, will help us to talk about it. And very interesting thing is, if the cortisol increases, if you're eating stressfully, if you're emotionally eating, you excrete a lot of calcium. Calcium deficiency is very, very easy in this kind of eating, and requirement of calcium now is 1 gram per day. That's the new RDM, it says. 300 ml of milk may be giving me 200, 300 ml of 3 mg of calcium. So I need to preserve my calcium with all these injuries and inflammation. Calcium plays a very integral role. So definitely bioavailability of food is an integral part of my food, and that I think will help my mind to work on food that when I eat with satisfaction. The bioavailability is all about digestion, feeling satisfied, happy after eating food. Right? And the combinations of food, which generally in our country, we have it, in our culture, we have it. So, increased excretion of minerals in stress is very, very proved and researched. So, why not look at giving a multivitamin or improve the combination foods and work on balanced diet to start with before they get into a weight loss diet? Do you all agree with this? Right? Now, another 10-15 minutes, okay? So, there's nothing good, there's nothing bad, there's nothing cheat, right? So, don't go on a diet. If you go on a diet, you'll start creating your own nomenclature for that diet. Cheat day, junk day, good day, bad day. It's all about portions. So few nutrition tips for us is portion control is the first goal. Eat everything. The dose is what it makes the poison. Ask yourself how much sugar threshold you have. It's very easy to understand. If you can eat 2 gulab jamuns, normal. People can eat a lot of sweet. The sugar threshold is something which we need to, if you see, food is such a thing which you can't tell anyone. You eat more, you're eating, overeating. It's a very sensitive issue to take out that culprit for anyone else. But if you start talking to yourself, how much sweet can I? It's a sweet tooth, it's not a sweet dish. A tooth is almost like a thumb size, we say in our nutrition language. Food is, stomach is this much, your cup size is this much, your roti size is this much, this is your teaspoon, this is your tablespoon. So your hand tells you what is a portion of food you can have. So when you know that my teaspoon is only this much and sugar is sweet tooth, how much can I eat? If you analyze, then you know that sugar is not bad. The quantity of sugar which I am eating is more dangerous. So definitely, each one of us will decide what is good for me. We will not try to get driven by vegan diets and keto diets and all that. Of course, it gives weight loss. Anything which makes you eat less gives you weight loss. And weight loss definitely has its benefits. So don't get credit to the diet. Give the credit to what your gut is being telling me. So definitely it's personalization of the diet, and nutrition system is science and information. Till now, I think more of observations and the diet patterns have been discussed. This shit diet, the Vekar diet, 2-meal pattern. It doesn't make sense, because in this era, we should first learn to introspect and talk to myself what suits me. Then maybe take the help of experts. This is what I'm eating. Am I doing right? Am I balancing my diet? Is my portions good? Do I need micronutrients? So definitely when you start indulging in these things, don't feel bad about it. A sweet after meal is absolutely fine. Don't say I like sweet and feel guilty about it. Coffee with a note of biscuits, if it's giving you happiness, it should be there. But if that is leading you to overeating and feeling guilty, don't do it. Dining out is important. Social drinking, if you feel relaxed, you should. Right? Indulgence once a while, eating for someone, because someone wants me to eat more food and that person feels happy when I eat food, that's okay. Then train your appetite. So this will help you for your metabolism. A very beautiful way of looking difference between nourishment and nutrition. Nutrition is macros and micros and digestion, assimilation, bioavailability. Nourishment is actually which ultimately reproduces and regenerates. The connect with food is nourishment. The food which gives me warmth, feel healthy, feel energized, and feel sense of life. So cooking is an integral part of nourishment. Somebody beautifully said in the morning that I want to cook food for my family, it gives me happiness. I should do it. Boys and girls, they should be trained to cook because it gives you nourishment, not nutrition. Nutrition and nourishment comes together. Varan bhat kara pan ghari karun kha. Because of oxidation temperature, like cooking vessels and all, the exposure to heat in large quantity cookery creates lot of trans fats, create lots of poor oxidants in your food. So even if you say I eat idli outside, the idli is made for a large quantity of food, or poha outside, your oil is being exposed to a very high quantity, the nutrition is zero in outside food. Right? Or if you have no choice, then I'll say 3 meals of a week, make it only fruits and vegetables. Again, it's all about manipulation and making changes, we all look at it. So explore your relationship with food, because nutrition is changing. It's a story each one of us have to narrate to ourselves first, and ask ourselves, what is my relation with food? To what am I eating? How much am I eating? Why am I eating? And then you will realize the perfect diet, you're only your own dietitian. You will come out with your own menu, your own eating pattern, your own hunger and appetite. And then there's popular nutrition systems. You can take it if you want to, but don't follow because somebody is telling you. Because all these nutrition systems are there, they are proved. But it's how sustainable. If you feel, I cannot do intermittent fasting, do not do it. But I want to do it, then try for it. So it's more important that what do you feel about the diet, and you start training yourself very gradually. You may reach there because your mind is getting matured. You're training your gut to give you a good release of dopamine to help you.